Ok, se di esame, ma se
I disagree with your disagreement.
talk to you later. Yeah. Fall under this category.
Have left me this thing. I don't want to prepare anything.
No, só para um peixe. Não vai, não, só uma vez. Não, só uma pessoa, não, dá para assistir. Vamos fazer antes, lá. Okay. 11 factorial.
What did he say? Uh, yeah. She showed me, I said, yeah, that's why I'm calling you now.
Which means I have interviewed.
Give me a minute. That's about Ya sálẹ o. Walaikum salam. Ẹ ṣé o.
in za a batu da shinkafa a wuri sai an mai karara ko
It's not. They are not careful. Just I don't want to go off. Àwọn tí program tẹ̀lé ṣe nílẹ̀ lọ́jọ́ mẹ́ta. Àti woman àti staff. Ẹ ń kọ́ yọ kúrò ní system yìí.
Ìbẹ̀rẹ̀ ní ká máa wá báírò àti ìwé lẹ̀. Because you are going to do calculation. Ó dà pé
Ẹ̀kọ́ ti ṣe.
A ti gbìyànjú abẹ́fẹ́ pa wá ni.
Listen. Picture.
Hello, good afternoon. Oh, morning, sorry. No, yet afternoon. Hello, good morning, all.
Good morning.
Yes,
Morning, sir.
yes. Please,
How are you?
we are very, very sorry. We want to sincerely apologize for this delay. This is basically because our facilitator has an unexpected hospital emergency which he must attend to. But everything is now under control and we should be able to start in around 30 minute time. Please, we are very sorry for this delay. We didn't intend to make people to wait unnecessarily. We are sincerely apologizing for this. It's due to situations beyond our control and its control. I hope our apology is going to be considered and accepted. So if you have some things to do, you can still do it. In 30 minute time, we should be starting, God willing, without any hitches. Thank you all.
Thank you, sir. Kai kuma yi shiru ku. Kai. Ya kayan da rafto ma da su kuma su za su sa. Kuma yi shiru. You guys should keep the
which hasn't been figured, but Western governments believe the attrition rate of Russian forces is significantly low. Ukraine won't say where, but intelligence are hidden. The U.S. and its allies continue to condemn Russia's threat, urging it to withdraw from Ukraine immediately. But this week instead, a major escalation. The Biden administration allowed Ukraine to use longer distance supply missiles inside Russia. In fact, with a
That's a lesson. Te me arrugo, no, la.
Like
Maybe you're done.
Nítorí pé ọ̀rọ̀ Ọlọ́run ti ẹ̀rí ní èsì ní ìwé Jòhánù orí ìkẹfà ẹsẹ̀ tí àdúrà talking about the word of God, we are talking about God.
We find an African playing the NFL. Now people tell me just because I play,
Christian is also giving back to its current home state for the creation of
screen, screen 2. Okay, good afternoon, everyone. Sorry, I apologize for starting late. I have to rush to the hospital. We have a relative who is on admission and requiring blood. I have to donate blood this morning. I hope we are going to do justice to the today's presentation. We are starting with exercise training. The purpose of exercise training programs are to enhance our physical fitness, for us to be able to undertake activities of daily living, participate in recreation, and to have endurance to engage in competitive sports. At times, one will be surprised when they say there will be novelty match. Usually, what physiotherapy do, to participate. Most of us may not be able to participate in those activities because of very low level of physical fitness. Though we are therapists, but most of us actually don't participate in those novelty matches because definitely we are going to be played and at times we don't enjoy it. Therefore, in exercise training programs, we enhance the fitness of individuals to perform activities of daily living, recreation, to engage in competitive sports, recreational sports, and so many. And then we also engage in exercise in order to prevent primary and secondary diseases. Primary diseases like heart disease, primary disease that involves that has to do with excessive weight gain, to combat physical inactivity. Those ones are what we call primary. Then we now have secondary diseases like stroke, like Parkinson's disease, like osteoarthritis. All those ones, one already has the condition, but primarily, secondarily, we want to use exercise as a remedy for the condition. Therefore, we want to use exercise to prevent further damage and to bring back the individual towards near normal or pre-disease condition. Using exercise. Then we also prescribe exercise for enjoyment, for hobby, for stress management, for psychological well-being, to manage anxiety, to manage depression. Therefore, exercise has a lot of benefits. Then that is by way of introduction. But when we are looking at exercise for an individual, then what do we need to exercise? Prescription. We have these ones are the basic. As physiotherapists, usually when you are looking at exercise prescription in, let's say, exercise science, at times they don't add progression. They only use FITT protocol. The frequency, the intensity, the time, and the type. Frequency, that is FITT, frequency, intensity, time, and type. There they don't look at progression. But we as rehabilitation experts, we have to progress our patients. Somebody come to improve. Somebody has a strength, muscle strength in his leg, let's say 3/5, and you wish to exercise this guy through strength training, that is resistance training, or through free active exercise to improve on his muscle strength, not to stay at that particular muscle strength of 3/5. Therefore, progression is an important component of exercise training for us as rehabilitation experts. We are going to look at each one of them. When we say duration, this is a 3-phase activity. It includes the brief and it includes the main brief cool down. When we say warm up, we mean we have to sensitize the body through stretches. We have to sensitize the body through doing some activities that would sensitize our heart, our skeletal tissues, our muscles, our ligaments, so as to prevent injury. Then we have the prolonged phase. Are you giving aerobic exercise? Are you giving resistance exercise? Are you giving flexibility exercise? Are you giving combination of some exercises like, let's say, interval training? Then we have the brief period of cool down. Then we now move to the next. When we talk about warm up, we mean low intensity. It can be low intensity exercise. It can be aerobic exercise. It can also be in form of low intensity strength training. But the rule of warm up is that it's usually similar to the move. It usually involves similar movement to what the stimuli will contain. What is that stimuli? They mean what that main activity of the day will contain. For example, I am interested in prescribing aerobic exercise for a patient. Then why should I now do warm-up with strength training, giving him weights to carry? Why should I do warm-up with only flexibility exercise by stretching? Why should I do warm-up in form of, let's say, interval training? The issue is, if I'm interested in aerobic exercise, then aerobic exercise should mainly be part of my warm-up. Then if I'm interested more in flexibility exercise, then a lot of flexibility exercise should be part of my warm-up. If I'm interested in weight, in strengthening exercise, then a lot of strengthening exercise should be part of my warm-up. Then I can include some flexibility exercise as well. But actually, they said the movement should be similar to what the stimuli will contain, what the main exercise will contain. Then you should use part of it as a warm-up. Then somebody will say, what is that part? What we mean is that if you are interested, if somebody is interested based on your assessment of the patient, you are interested in patient carrying the weight of, let's say, 5 kilograms, then the warm-up can involve somebody taking half of the weight or less than half, let's say 2 kg, as a form of warm-up before he takes the 5 kg. That is what they mean. Therefore, you now reduce the intensity. If somebody is to walk on treadmill or to run on treadmill at, let's say, 6 kilometers per hour, you can do your little warm-up at 1.5 or 2 kilometers per hour, little for some time, then before you start the main exercise. That is what they mean. Then we have advantages of warm-up. What do we gain when somebody engages in doing this warm-up? They say it prepares the cardiorespiratory and musculoskeletal system to meet the challenges of the main exercise. That is the reason why the warm-up must be a little bit similar to the main exercise, but because it prepares you. It's not all exercises that targets cardiovascular system. Some exercises target musculoskeletal system, like strength training, like free active exercise, what do you call it? On let's say sit to stand exercise. Therefore, the most important thing is it should sensitize, it should prepare some organs in the body because of the activity that will follow. The second point is that it decreases the incidence of injury by increasing what do you call it, elasticity of your muscles, your tendons, and all other connective tissues. Yes, it is very common for us to see footballers, basketballers, whatever, before they enter the field, if they are to be introduced, they would have to be doing warm-up, doing some stretches. They are very, very important. They help to prevent the incidence of injury in your muscles. They help to increase the flexibility of your muscles, the strength and flexibility of your tendons and some connective tissues. Then they said exercise, what do you call it? Warm-up exercise also stimulates and increase vasodilation and local tissue perfusion before the more intense conditioning begins. Yes, actually, what is required? We are going to later calculate what we call VO2 max, VO2 peak, and all these guys. But why are we really interested in VO2? We want to know the amount of oxygen that is being taken by individual and the amount of oxygen that is being utilized by the individual during exercise is a marker of fitness of that individual. But one thing that is very important is you can never get enough oxygen to the working tissues without blood, because it is the blood that carries hemoglobin. Therefore, this warm-up increases vasodilation of your what do you call it, and perfusion of what do you call it, working muscles, such that when the more intense exercise come, there will be free movement of blood and what do you call it, nutrients to the working tissues, and free movement of waste products away from the muscles. Then we have increased joint range of motion. Yes, it's part of flexibility. Decreased muscle viscosity. Yes, at times when one wants to start exercise, there should be free movement of both agonist and antagonist muscles, or the same agonist muscles, but because they are being divided, each muscle group is divided, is being separated from another muscle group by a fascia. There should be free movement of one fascia over the other. The sliding should be so free. If not, somebody is going to have tear. We used to see it, footballers coming with hamstrings tear, footballers coming with what do you call it, quadriceps injury, back injury, if there is no one, if there is what do you call it, friction between the fascias within the muscle group. Then we now move to cool down. When we say cool down, we now talk about, remember we said exercise has 3 phases. That is the duration of the exercise. We have what you call the warm-up, we have what you call the main exercise session, and we have the cool down. Then we are now looking at the third part, which is the cool down. What is this cool down? We mean somebody coming to rest after an exercise duration. For example, after a warm-up of 10 minutes and a main exercise of, let's say, 40 minutes, the individual has spent 50 minutes, and it is to cool down. Then this cool down it can also be performed at 50% of the intensity. If one is running on bicycle ergometer, let's say at at 120 revolutions per minute, or let's say 200 revolutions per minute, that is around 200 beats per minute, which is around 100 revolutions per minute. One can do is cool down by reducing the speed to 50 revolutions per minute from 100. Then you now cool down gradually. Or some individuals will jump off the treadmill. Some individuals will jump off the basket ergometer because they want to stop. That is abrupt stopping. Actually, abrupt stopping is not actually a good cool down process because it is associated with some adverse events. We actually advocate active cool down, not abrupt cool down. In active cool down, we say it facilitates gradual transition to exercise cessation, and it should be performed at 50% of the intended intensity. What is this active cool down? We have said it. You don't just stop at once. You reduce your speed while keep moving. Then they say the advantages. It decreases the rate at which one becomes injured. You don't just stop. And then they now talk about dispatching body heat. You have the individual doing exercise must have generated a lot of heat in his body. Muscles generate heat. Not all the heat will be dissipated. One will just be sweating as a way of reducing body temperature. But it's not enough. A lot of lactic acid, because of due to the intensity of exercise, must have accumulated. Because of the exercise, the heart is beating fast under the influence of adrenaline. Therefore, all these ones will now come down to what? Baseline or normal levels, cooling down gradually. It will take 5 minutes. You just come, you will just be continue doing exercise, but at what? A slower pace, and then all the heat, all the lactic acids, all the adrenaline will now reduce to basic level. The other one is heart rate and blood pressure. Yes. When your heart rate comes back to normal levels, somebody who is doing exercise. But when heart rate is very high and blood pressure is very high, and one abruptly stop doing exercise, what happens? There will be there will be pulling of blood to the leg, because the heart has beaten blood down to your lower extremity, but there is lack of muscle pump to push venous blood to replace the arterial blood that has gone into circulation. Then more of the blood will now be pulled down in the leg because of lack of muscle pump when you stop activity at once. But as the heart is reducing in activity, it is reducing the rate at which it sends blood to the system, then be pumping blood gradually back to the heart, through the right ventricle, so as the individual will cool down and the blood pressure will not come down and heart rate will come down gradually. But with abrupt cool down, what happened is the blood pressure is there, but the muscle pump that will pump blood through venous blood in the leg is lost. Therefore, there will be pulling of blood in the leg and hypotension will occur. The third one is it helps to clear with metabolic waste from the skeleton and from the body system, which we have said. The next is the main exercise. When we say the main exercise, we mean the activity you plan for the patient. We are planning warm up and cool down to prevent injury and to ensure that everything is okay. But for the main exercise, that is what you want to condition. We call it conditioning exercise. You want to condition a part of the body system. Is it a flexibility exercise you want to do to increase range of motion for an individual who is having reduced range of motion? Or is it a strength training? Is it a coordination training? Whatever you want to do is the main exercise. They say the entire exercise duration should not exceed 1 hour. What we mean by the duration not exceeding 1 hour, meaning that if you have 10 minutes warm up, 10 minutes cool down, then at least 40 minutes should be for the main exercise. You can have 5 minutes warm up, 5 minutes cool down, and main exercise can take you up to 50 minutes. It depends, but it shouldn't, all the session should not be more than 1 hour. The main aerobic exercise can last between 30 and 50. If it is 30, then you have 15 minutes warm up, 15 minutes cool down. It's okay. Then 30 for the main exercise, or 50 for the main exercise, 10 for warm up and cool down. Okay, it may also contain bouts of 10 minutes of exercise with rest time. What they mean here is you have a convalescent, a patient that is recovering, and then you want to exercise this guy for 30 minutes or more. The individual, probably because of the disease condition, may not be able to do 30 minutes of exercise. So the most important thing is for you to give 10 minutes of exercise, the individual have a rest, let's say for 2-3 minutes, another 10 minutes of exercise, rest for 2-3 minutes, another 10 minutes of exercise, rest for 2-3 minutes. That is the 10 bouts of 10 minutes of exercise for you to reach either 30 or 50 minutes. But at the tail end, the individual should be able to walk for 30 minutes or 40 or 50. It depends on what you want to do for the main exercise. Then, if the main exercise is resistance, one can give resistance training for about 30 minutes. But they say the resistance training must be given to up to 10 major muscle groups in the body. Actually, the recommendation of World Health Organization, a recommendation of American, College of Sport Medicine nowadays, they don't advocate, most especially for young persons and for geriatrics, they don't advocate for aerobic exercise alone or flexibility exercise alone. They advocate that you should also give some strengthening exercise. As one is aging, sarcopenia is setting in losing muscle fibers, one should, and then also losing muscle strength, one should engage core muscles and peripheral muscles of the limb in doing some resistance exercise, meaning that it is advantageous. Even if your main target is to do aerobic exercise, but in a way you can also increase what? Resistance training. And they said the 30 minutes for resistance training is not like aerobic exercise where I put somebody on treadmill and he perform exercise for 30 minutes. It's not like that too. When you check 10 major muscle group in the body, you can give exercise that will last for 2 minutes, resistance exercise that will last for 2 minutes, and then 1 minute rest. Then you now move to another muscle group, 2 minutes, 3 minutes, 1 minute rest. By the time you reach 10 muscles for 3 minutes and 1 minute rest each, you must have spent 40 minutes, but 10 minutes is for rest and 30 minutes is for resistance training, which is very, very important. In as much as we know, we want to improve muscle endurance, we also want to improve muscle strength in most of our patients and clients that come. Another good thing with resistance training, like I know last week, a colleague presented a seminar or workshop on weight reduction. Yes, somebody can do weight reduction through diet modification, but it has one big disadvantage. You can do dieting alone without exercise, but you are not going to get it funny because your skin, you lose weight, you lose a lot of fat, but your skin will now sag. Somebody will now see his skin sagging in the face, sagging as if you are becoming old, in your tummy sagging. Then part of the reason why we have to combine both aerobic that is meant to reduce fat and some resistance exercise, the resistance exercise will turn up your muscles, will increase muscle bulk to fill that particular gap that is being created by loss of fat. Therefore, you will now see somebody doing resistance training, adding aerobic exercise, then interspersing with resistance training, maintaining a very tough skin, despite the fact that he was a bit heavy before. The secret is resistance training helps to turn up your muscles, it helps to increase your muscle bulk to fill the gap created by loss of what or burning down of fat. Okay, then we now have the mode of exercise. We have talked about resistance training. We gave example of the duration of resistance training. The aerobic training can be up to 30 to 50 minutes. Resistance training can be up to 30 minutes. Flexibility training can be up to 30 minutes. And then we have some warm-up, we have some cool-down. Then the next thing is we want to look at the mode or type of exercise. We said this involves choosing appropriate type of exercise. What did the patient want? The patient wants a queuing training. A queuing training is meant for somebody who has Parkinson's disease, for example. What type of exercise is that one? Patient requires just walking exercise, brisk walking. Somebody who is coming to your place wants to lose weight because he's either diabetic or is overweight, or he has been prescribed aerobic exercise, to lose weight. Majorly a candidate of aerobic exercise, but you can intersperse resistance training. It depends on what you want to do. Then somebody may have a combination of aerobic and anaerobic exercise. Then somebody will say, what is an anaerobic exercise? Any exercise that is done at a very high intensity, like for example, 100-meter dash. When you say Usain Bolt, 100-meter dash, that particular exercise Usain Bolt are doing for 100 meters, that exercise is not aerobic. It is what we call anaerobic exercise. The body does not have enough time to metabolize, to use oxygen to metabolize substrate. What happened is, those doing that exercise, we utilize only the glycogen in their muscles and the little ATP that remains to do the exercise, but they don't have time. The body does not have time to utilize oxygen to break down substrate. But when one is doing aerobic exercise, the body have enough time to utilize oxygen, and the body has enough time to engage mitochondria to provide enough oxygen so that fat can be broken down. One thing with fat is that it has a lot of carbon. It requires a lot of oxygen to burn. Therefore, for you to burn fat, you have to engage in low-intensity exercise like aerobic exercise, and you have to do it for a long period of time. That is it. But if exercise is highly intensive, then the body does not have time to metabolize oxygen. Therefore, the little glycogen that is stored in your muscles will be utilized for that activity. And usually, that high-intensity exercise usually lasts for less than, let's say, 1 minute. At times, within some seconds, they must have finished 100 meters. Those ones are anaerobic exercise. One characteristic of anaerobic exercise is it lasts only for a short period of time. The individual will become fatigued. If not, he's going to have muscle cramp and he's going to have muscle pain because of lactic acid. The body generates lactic acid because there is not enough time for the acid, to be neutralized by oxygen. Therefore, lactic acid will be formed, and that is all. The next thing is, when I talk about aerobic exercise, we define it as an exercise in which the body's large muscles move in rhythmic manner for a sustained period of time. Therefore, when you sit on bicycle ergometer and you keep doing bicycle ergometer exercise at a very low speed, let's say 60 revolutions per minute for 1 hour, what you are doing is aerobic exercise. You are using large muscle group in the body. You are exercising. If the large muscle group can be in that of the arm for arm ergometry, you can be doing it at low speed for a long period of time. Okay? The term moderate intensity, longer duration exercise, that is another term we use to describe it. We say it is termed moderate intensity but longer duration exercise. Therefore, the example of typical aerobic exercise is what you used to see the marathoners doing. Somebody going through 12 rounds of exercise in the stadium. 12 rounds of exercise at a very low pace, or jogging, the way we used to do it in NYSC. Therefore, they take it through the whole, town, jogging gradually, singing. That is aerobic exercise. Then they said, energy is produced by Krebs cycle, an electron transport chain, and by utilization of oxygen, meaning that when you have few oxygens produced through Krebs cycle, this oxygen is utilized via electron transport chain, and more oxygen will be produced for the body to use. Okay, then they said example of this one include our real walking. If you walk from your house to your school, what you are doing is aerobic exercise. Therefore, we have brisk walking, the one we used to advocate for individuals that have diabetes, for them to break down excessive fat, and for them to stimulate, most especially those ones that have insulin, sensitivity issues, such that insulin will be able to, metabolize the sugar we take. Then we now have swimming, bicycling, jogging, treadmill walking. All these ones are example of aerobic exercise. Another example of aerobic exercise can be dancing. If one does a lot of dancing at a slow pace, all these ones can be aerobic exercise. Then the next is anaerobic exercise. We said sprinting is an anaerobic exercise. Yes, at times when you talk about resistance training, some of them can be anaerobic exercise because they are just muscular exercise. You don't need to take in enough oxygen for you. You can even hold your breath and do resistance exercise. They're anaerobic. But high intensity exercise that can only last for only few seconds, and you are tired, is an anaerobic exercise. They said by definition, it says an exercise in which non-aerobic metabolism begins when the energy needed exceeds what oxidative process. There is no enough time for the body to oxidize oxygen. Therefore, for oxygen to be used for oxidation. Therefore, that is anaerobic exercise. The energy provided is by ADP and inorganic phosphate. Then they said PI is donated by creatine phosphate, which is in our muscles. Then they said glycolysis also provides some ATP that will last for up to a minute or half. Therefore, that is what glycolysis do. And immediately after glycolysis, lactic acid will produce. But we are ever enter the second phase where you have electron transport chain, chicken no wahala. Then they say short-term, high-intensity, low-duration exercise like 100 meters. Flexibility training like stretching. When you are doing stretching, you don't need this thing. Then you have resistance exercise. They are all anaerobic modes of exercise. Then when we now move to flexibility exercise, we say this involves 3 types of stretching techniques. We have what you call ballistic stretching. This ballistic stretching is actually not utilized by us physiotherapists. It is people in exercise science that used to as trainers for sports individuals that used to teach ballistic training. Ballistic training is a bouncing movement to lengthen a muscle. We used to see footballers in the field doing hamstring stretching by doing ballistic movement. One is standing, will just go down and stretch the legs. Those ones are ballistic stretching and they can lead to injury. Then we now have what you call static stretching. That is what we use as physiotherapists. We use what you call, usually we used to call it sustained passive stretching. Slow sustained muscle strengthening, less likely to cause injury or soreness. Therefore, if one is having TA tightness, you do stretching. Some individuals can do hamstring stretching, even if it is a football. Just static stretching is less, it does not cause harm. Then we have PNF stretching. Everybody knows, as far as we are physiotherapists, we know about the PNF. Therefore, the movement in diagonal direction and the stretching that has to do with it at times to elicit some contraction in the muscle is part of also stretching. And then we use it, in rehabilitation setting. These ones are the forms of stretching we have. Then the next is what are the advantages of stretching. We said it preserves and increases range of motion of joints. Therefore, even if it is a patient that comes to you, like it's very common among physiotherapists, when a patient comes to us, even when we want to ask them to go to the gym, at times we do some range of motion exercise, at times we do some passive stretching for the individual. Therefore, these ones help to preserve and increase range of motion of joint, and also to increase the flexibility of the muscles and connective tissues so that they can lengthen or assume their original length. Then it helps to progressively enhance performance and prevent injury. Then the next is resistance training. We said in resistance training, or what you call strength training, we mean muscles working against external resistance. But actually, it is not always that we use external resistance. Resistance can come in form of our own body weight. Therefore, when I put a chair and I ask somebody to do sit to stand exercise, is this strengthening exercise to the quadriceps if I'm doing sit to stand exercise, but the external load is coming from, what do you call it, the weight of my trunk. That is resistance training. We can also use weights. Example of weights we can use the sandbag. We can use our multi-gym. I'm going to see some form of strength training programs that are very common. We can use our multi-gym to do a lot of exercises, strength training exercises. We can use the barbell, we can use the dumbbells, we can use our body weight, we can use the springs that we have. We can use TheraBand of different colors and different resistance. We can use the therapist hand. Yes, therapist hand can be placed on somebody's shin, so as to provide resistance when doing quadriceps exercise. Then they say the training weight is calculated based on 1 RM, 1 repetition maximum. Therefore, another factor in using weight is the issue of 1 repetition maximum. Somebody will say, what is this 1 repetition maximum? What we mean by 1 repetition maximum is the maximum amount of weight one can carry only once with good posture, with correct technique. Therefore, if you give me a weight of 10 kg and I'm able to lift that particular 10 kg only once, after which I am tired, I can never lift until after 2 days. That is my 1 RM. If you give somebody a weight of, let's say, 2 kg, a child with a weight of 2 kg, and he's only able to carry it only once, after which he is tired, then that 1 repetition maximum. Then if you are looking for 2 repetition maximum, any weight you can carry 2 times, that is twice, and you are tired, you cannot carry anymore. The same thing with 10 repetition maximum. Any weight you can carry 10 times, after which you are tired, that is your 10 repetition maximum. Then how do we now get 1 repetition maximum? If it is in my clinic, for example, I can say, okay, carry, for example, I want to see the 1 repetition maximum for hamstring muscles. I place the individual such that I'm going to elicit the contraction of the hamstrings. I tie weight on the the heel area. Then I ask that individual to lift it. Then if he's unable to lift it, probably in standing, I ask the individual to stand, I put weight on the heel area, and I now say he should flex the leg up such that the heel will approach his hips. Then I am moving hamstring muscle are working against gravity. Then if he's able to carry that one only once and he is tired, that is his 1 repetition maximum. And if he's able to carry it 3 times and he becomes tired, then I'll ask him, okay, then I will now reduce the weight or increase the weight because I want 1 repetition maximum. If you are able to carry it 3 times and you are tired, meaning that you have not reached 1 repetition maximum, I may increase the weight until I am able to get a weight that this individual will carry only once. But it's going to be tedious. At times, in trying to assess for 1 repetition maximum, the individual is going to be overworked. Then they come up with a formula where one can, where one can objectively predict the 1 repetition maximum for the individual. And then this comes in form of a formula, and the formula is here. We now have the predicted 1 RM must be equal to the weight lifted divided by 1.0278 minus 0.0278 N, where that N is equal to the number of repetitions. Yes, but they say the test is valid only when N is less than or equal to 10, meaning that any weight you want to determine 1 repetition maximum using it, and you give that individual to carry, and that individual is able to lift that weight more than 10 times, don't use this formula. But you give him weight that after carrying it 7 times or 8 times, he said, I am tired. You cannot do any work. He said, no. That is his 8th repetition maximum. Then you now put N, then now is 8. Then you now put it in the formula. You now put the weight lifted. For example, you give somebody 5 kg to carry, and he's able to lift it, let's say using bicep curl, that's biceps exercise in sitting, and he's able to lift it, let's say only 7 times, and he said, Kai, I cannot do anymore. That weight of 5 kg will now be the weight lifted 5 kg. all divided by 1.0278 minus 0.00278 n. N is the number of repetition. Probably if he's able to carry it 7 times, you put n there. Then with this formula, you will now be able to gauge his 1 RM. When you get 1 RM, ask him to come another day. Give him the weight you think is based on your calculation is 1 RM. I'm very sure that he is going to carry it only once and he's tired. You are able to determine his 1 RM. Then another issue with what do you call it, resistance training or free active exercise is the issue of set and repetition. What is set and what is repetition? What we mean by set is okay. What we mean by repetition is the total number of time an exercise is repeated. For example, I ask somebody to do let's say to and fro movement from one end of the gym to the other end. Somebody keeps moving, he goes there, I said 1, come back 2, 3, 4, and he's able to do 10 repetitions of to and fro movement. Shikena, I got repetition. But if I say set, I mean a series of complete round of repetition of exercise performed sequentially. What they mean is that now I can decide that this individual should not do 10 repetitions and what at once. I will now say do 2 sets of 5 repetition. Do 2 sequential sets of 5 repetition. What I mean is that individual will just do 2 and fro 1, 2 and fro 2. After he is able to do 5, I will say rest. Then after that, I will now ask him to do another 5 rest. It's the same 10 repetitions, but the first one is done at once. The second one, we have what? 2 sets of 5 repetition. They are also 10 repetition. That is the difference between set and repetition. In set, you have series of complete rounds. Like let's say 5 sets, you rest. Another 5 sets of repetition, you rest. Then example, we give an example. We have 30 repetition of sit to stand. I ask somebody to use a chair and do sit to stand exercise. If he's able to do it 30 times, no problem. But if he's unable to do it, I can say 10 pounds of what? 30 repetition, meaning that 3 sets of 10 repetitions. We now have 3 sets of what? 10 repetitions. It's something as 30 repetition. That is different between a repetition and set. Then the next about mode of exercise, we talk about what do you call it? The main exercise and cool down. Now we are moving to what we call frequency of exercise prescribed for an individual per week. Then if somebody asks me, like for a patient now is about to leave my place after he has done some training, and then he asks me how many how do I be how many times will I be doing it at home? I'll say between at least he can do it 4 times in a week, meaning that perform so many of exercise 3 times weekly. That is it. You are prescribed frequency of the exercise. Number of times somebody repeat an exercise per week is the frequency of exercise. Then when I said it depends on the patient fitness level, the goal of training, the disease condition, and the amount of recovery required from the last session of exercise. Yes, for example, in aerobic exercise, aerobic exercise can be prescribed to be performed every day. The more you do, the merrier. But resistance training has has a rule that you cannot exercise patients until after he has observed 2 days of rest from the previous resistance training. Meaning that if I give resistance training today using weight, I should allow the patient to rest at least 2 days before I give him. Therefore, in a week that has 7 days, meaning that the patient cannot exercise more than 3 days in a week. That is one thing with aerobic training. Exercise Monday, rest Tuesday and Wednesday, exercise Thursday, rest Friday and Saturday, exercise Sunday. Therefore, in a week at least, the individual should be able to exercise 3 times in a week, giving at least 2 days interval. That is what it means by the amount of recovery. The recovery from resistance rest before you move in. If not, germs will set in, delayed onset muscle soreness, muscle tear, and that will demotivate your patient. Then the second thing is the frequency of exercise is usually between 3 to 5 or more days per week. Therefore, the more the days, the merrier. Then we now have the frequency of resistance is 2 to 3 days per week. If you does it twice weekly, no problem. If you does it 3 times weekly, but it shouldn't be more than 3 times weekly, because the amount of, especially when one lifts a very heavy load during the training. Then we have the last, second to the last component of exercise prescription is what you call intensity, exercise intensity. Please, the whole of what you call exercise prescription, the whole of exercise prescription is trying to regulate the intensity of exercise. It's trying to see how we can do good to the patient without harming the patient. The only component of exercise that actually can either undertrain or overtrain or harm the patient is the intensity. This is the measure, we said it, that intensity is the measure of vigorosity of exercise. How vigorous is the exercise? Do you really train individual at optimal level that he is going to reduce weight? Did you train individual at optimal level that is going to get strength? Did you treat individual at optimal level that is going to have his disability or pain or whatever reduced? Or did you undertrain individual? Or did you overtrain individual that he develops sickness or that develop muscle pain? Did you overtrain individual that he develop muscle tear? Therefore, its exercise intensity, actually, measurement of exercise intensity is paramount, is relevant, and is needed in exercise prescription. Therefore, generally, there are 2 methods of determining exercise intensity. There's what you call estimation method and exercise testing method. Estimation method and exercise testing method. And these ones are very broad, each one of them. The estimation method requires that you use formulas. You calculate some parameters to estimate the intensity of the exercise. Therefore, you use some parameters. You use, it can be heart rate, it can be oxygen consumption, it can be anything. It can be calories expended, it can be anything. It can be bulk rate of passive exertion scale, the way the individual tells you that he is tired. It depends. These ones are estimation method. And then we have exercise testing method, where somebody will now be subjected to either maximum or submaximal exercise test to determine his fitness level, and that will now be used as a gauge to giving him exercise regimen and to determine his exercise intensity for the next exercise. Therefore, we are now going to have estimation methods. The estimation methods generally are what we call, the first one is talk test. The second one is rating of passive exertion. The third one is target heart rate. The fourth one is metabolic equivalence calculation. The fourth one is calorie calculations. Because actually, there is another one I did not put here. Calorie calculation. We utilize calorie calculation to also get or gain insight into the total amount of fat to be burned. Therefore, we are going to do some calculation there. How do we know? How do we design a session in such a way that we are going to burn 10 pounds or we are going to burn 4.5 kg of fat in this individual? How do we design it? When we get to the bridge, we cross it. Okay, we now said we start with what do you call it? Rating of passive exertion. Everybody knows what we mean by RPE, rating of passive exertion. Here, what we use is we actually do here. Okay, let me start with the talk test. I think I skipped something. Let me start with the talk test. We do talk tests in our clinic every day. When somebody is on treadmill, somebody is on bicycle ergometer, you ask somebody to do some exercise, you keep asking him, are you tired? Are you comfortable? Are you this? And when the patient says, no, I am not, I am tired, he stops. Or you reduce the intensity. But actually what it means here in the talk test is when you subject somebody to any form of exercise, whether aerobic or resistance exercise, that individual, when being asked, what is your name? He's supposed to say his name fluently. My name is Dr. Umaru Badaru. That means that individual is working at moderate exercise intensity. When you ask him, what do you call it? How many times did I ask you to do this exercise? He said 20 times. Then that means the exercise is not on the high intensity side. That individual may be at moderate intensity. That is a talk test. But where somebody is on treadmill, and you ask him, what is your name? And he was doing, and he could not say his name. That is a high intensity exercise. Therefore, we say talk test, the client comfortably, what do you call it? Talk during exercise, and is associated with overall cardiovascular safety. The next is rating of passive exertion. We want to see how the individual, this is also subjective. The individual is now the controller of the intensity. All you just need to. Are we together? Hello? 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 Are we together, please? Hello?
Yes,
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 sir.
sir.
Yes, sir. We are together. We are following you, sir.
Okay. Then they said the training intensity is based on subjective assessment of exertion. The patient is now the controller. What we normally do is we have what you call 0 to 10. That is the revised box scale. And then we have the one that is 6 to 20, rated as between 6 to 20. That is the extended one. That is the original box scale. Normally, what the patient requires, if he's to go on treadmill, bicycle, odometer, or whatever exercise you want to give him, is for you to teach him the meaning of BOG, rate of passive exertion scale, and what it's going to be used for. The word is, when it is this, it means this. When it is this, it means this. Meaning that when somebody is at moderate, he knows he's at moderate. When you said, if somebody tells you that I am, somewhat hard, meaning that is at moderate. But when somebody says hard, meaning that he has passed moderate. Therefore, what happens is when you teach the individual how to use it, the individual will now be telling you that, yes, I am at this place. Probably you have to reduce the intensity. That is another way of trying to give intensity. But it's not very objective, it's subjective, it's the patient that tells you. A patient that is actually not very fit enough, somebody who is sedentary, and you want to start exercise with him, it's easy for him, after doing little exercise, to tell you that, yes, actually it's hard. Therefore, that is what makes it a lot of subjective. But somebody who is doing a lot of exercise is hard. Okay, now they said the client is well educated about working on the scale. The trainer asks the client to rate how hard the exercise is at interval during exercise. After every 2 minutes, how hard is it? He will say, oh, I can still continue. That is it. Then we now said it involves using bulk rating of a scale between 6 to 20 or 0 to 10 scales. Okay, we have this one. Hafiz, can you see it? Okay, can you see it over there? Okay, you have the one that is rating of 0 to 20. You can see 6 means no exertion at all. You started gently with little warm-up. Somebody will tell you, no problem. By the time you reach 7.5, somebody will tell you, this is extremely light. I begin to feel it, but small. By the time he reaches 9, it's light. By the time he reaches 11, it's light. But by the time he reaches 12 to 13, he will tell you, yes, and now begin to feel it. And he can talk. But by the time somebody reach, hard or heavy, when he says it's hard, but he can still talk fluently, no, he is still at moderate. When it is hard, somebody can still talk, but he takes some time to breathe before he talks. And when it is like 17, very hard, yes, the breathing is far more. If you are taking it 100%, then the breathing takes 60 to 70%, talking takes only 30%. When it's extremely hard, like 1920, individual does not even have time to talk. What is your name? You'll just be panting. Then we should not take that patient to that particular stage. Then we can see the bulk rating of passive scale. what do you call it? The revised one. We can see CR. The CR is what? The revised one. It is cut from 0 to 10, just like the other one. But here, where you have moderate is at 3. Some people will tell you is between 3 and 4 or between 4 and 5. But the most important thing is this is what they use and we can use it. Somebody who tells you that he is at moderate, but he is gasping for oxygen, meaning that has passed moderate. Okay. Now we have comparing the interpretation of Borg rating of passive exertion scale. We have WHO publication by Bull et al. That is Sandra Bull. We have Norton et al. We have American College of not sport exercise, American Heart Association. That is the Fletcher et al. How do they now? We want to see the way the rate of the rating of passive exertion. Like you can see under Bull et al. 2020, under RPE 0 to 10, they said somebody who is having RPE of less than 2 is sedentary. Somebody who is having RPE of 2 to 4 is light. Somebody who is having RPE of 5 to 6 is what? Moderate. But somebody who is having RPE of 7 to 8 is hard. Meaning that when you are doing exercise on somebody and his RPE reaches up to 7 to 8, meaning that this individual is working hard. Then look at Norton et al. The same, very close. They also use RPE of 0 to 10. But here, what Norton et al. Did was they said less than 1 to them, based on their rating, is sedentary. Light is 1 to 2, while you can see that of Bull et al. Is 2 to 4. For Norton et al., 3 to 4 is moderate, but for Bull et al. Is what? 5 to 6. But the most important thing is that the patient should be able to talk and should be able to tell you that, yes, the exercise is somewhat hard. I can feel it, yes. Then where is heavy? Bull et al. Did not talk, but Norton et al. Is around 5 to 6. The same, in Bull et al., 5 to 6 is moderate, but in Norton et al., 5 to 6 is a bit heavy. Then, but all of them concur. Any score greater than 7 or 7 is what? Hard, on 0 to 10. Then look at, Fletcher, the last two, we have Fletcher et al. 2001, Norton et al. 2009. They talk about 6 to 20 on the rating of passive exertion scale. One good thing is that look at moderate. This one says 12 to 13, this one says 11 to 13. Therefore, there is almost a consensus that when you are between 12 and 13 or 11 and 13, you are likely going to be at moderate intensity. Look at another consensus on heaviness of exercise. When somebody says somewhat hard, the exercise is hard. Now, it's at between 14 and 16. And then you can see hard. There is also consensus here. Anything between 17 and 19, you can see. Therefore, one thing is with the rating of passive exertion, the patient tells you where he is, and you look at it, and you look at the amount of activity patient does so that it can guide you. Okay, now exercise intensity. We are now going to take another parameter for determining exercise intensity, which is called the target heart rate method. The target heart rate method. Target heart rate method. What do we mean by target heart rate? If we want to prescribe exercise, there is There is a formula that we use, but the formula utilizes the heart rate of the individual. And then why do we utilize heart rate in prescribing exercise? It's because of one thing. The heart rate has what you call linear relationship with exercise intensity. As the intensity increases, your heart rate increases. Let me give you an example. You are sitting now, and somebody says, snake. What happens is everybody will run. The people that run faster, when you check their heartbeat, it will be faster. The people that run slower, their heartbeat will be what? Slower. Therefore, if somebody who runs very fast will reach a heartbeat of, let's say, 130, somebody who is running, very gently may have the heartbeat of heart rate of, let's say, 110. Therefore, the issue is the faster you move, the more the heart rate, meaning that heart rate increases with increase in exercise intensity. Then there are two major methods that we use in determining the heart rate. The first formula is what you call the age-predicted maximum heart rate formula. The second formula is what you call the heart rate reserve formula, or the formula that was proposed by Carbonate and Associate when they realized that age-predicted maximum heart rate formula is having problems. They realized that it has some limitation. Then what they did was they come up with solutions so that we can solve the problem encountered in age-predicted maximum heart rate formula that is up till today being utilized, and it is respected worldwide. Okay, the first one is age-predicted maximum heart rate formula. Then can you now look down under the subheading target heart rate using heart rate max? You can see heart rate max, or what you call max HR, that is heart rate max, is equal to 220 minus age. This is a formula. Please, this is not the only formula that they use to get. We have 210 minus something and plus age. We have all these sort of formula. But this one is also universally accepted. 220 minus what? Age. Therefore, when the patient comes and he said his age is 20, if it's a 220 minus 20, his maximum heart rate is what? 200. When somebody's age is 30, 220 minus 30 will give you 190. That is his own maximum heart rate. In essence, the older you are, the lower will be your what? Maximum heart rate. If somebody is 40 years, when you say 220 minus 40 will give you what? 180. If somebody is 50 years and you say 220 minus 50 will give you 170. The older you are, the what do you call it? The slower, the lower will be your maximum heart rate. That is how they do it. Then they say we utilize this maximum heart rate to calculate exercise intensity. Now, usually in exercise, we don't prescribe exercise intensity at only one level. We prescribe exercise intensity at lower and higher level. For example, you can start exercise at the heart rate at the beginning of with exercise heart rate of, let's say, 100 beats per minute. As we keep increasing the speed, there is a tendency you now reach 140 what do you call it, beats per minute of your heart rate. That means that your heart rate can always increase because your heart rate can increase with intensity, and we are meant to increase intensity so that we condition your body. We cannot just say somebody should just exercise at what do you call it, as 110 beats per minute. Meaning that when you use your treadmill or you use your what do you call it, heart rate monitor, and you see 100 beats per minute, you cannot go further. You have to give what? A range between 100 and 160, meaning that one can exercise. That is the way we use, or how you use it. Then they said we give example that we should choose the intensity as percentage of maximum heart rate. Example, I said somebody should exercise 60 and 70% of 50 and less than 70, 55 and less than what? Participants at the workshop, can you hear me? Internet is unstable. Hello?
Yes, sir. I can now see you, sir.
We can hear you, sir.
Okay. We are still at what do you call it? Maximum heart rate. Therefore, if my age is 20, if I say 220 minus my age, that's 20. That means it's 200. Then when you say 0.6 times the 200 that you got after you minus 220 minus 20, will now give you the lower limit. For 70%, I will now say 70 over 100, that will give me 0.7. If I say 220 minus that my 20, that will give me 200. Then I will now say the upper limit is 0.7 times that my 200. That is how we get it. Then you can use a heart rate monitor on the treadmill. Or these days, nearly all physiotherapy departments will have what you call it, treadmills with heart rate monitor. You have the handle where you hold the treadmill. That is the rail where you hold the treadmill during exercise. Usually come with a lead. When you put your hand on the lead, it's going to give you your heart rate. Or at times you wear a heart rate monitor in your wrist that will be making beeping sound when you are going below or above the upper or lower limit. Then that is it. Now, what are the disadvantages of using maximum heart rate formula that warrants the, what do you call it, the development of another formula which you call the heart rate reserve, which is universally used today, or the Cavonin formula of Cavonin and associate. Okay, they said heart rate or age, they said heart rate, what do you call it, maximum heart rate formula actually is dependent on the age of the participants. For example, if I am 50 years old and somebody is 20 years old, for me who has 50 years, who is 50 years old, I'm going to get lower maximum heart rate. For somebody who is 20 years will get higher maximum, what do you call it, heart rate. Therefore, the maximum heart rate for you to exercise at lower or higher level will depend on your age. But one thing is that the formula does not take account your fitness level. Somebody will say, how? Now we have two people born the same day. They are twins even. One of them is actually sick and he is recuperating. He is with you in the clinic. His brother came along with him and they say you should use maximum heart rate formula to calculate exercise intensity for them. Do you think somebody who is sick, who has been hospitalized for long, will perform exercise at the same intensity as his brother, who is physically fit? No way. Therefore, the issue is it does not take cognizance of what your fitness level. It's only what gives you what do you call it, maximum heart rate based on the age of the participants, but does not take cognizance of the fitness level of the individual. Then these people now said, Kai, then we should come up with another formula that will now take cognizance of our fitness level. Then another disadvantage of maximum heart rate formula is that it lowers, or it what we call undermines your target heart rate. What we mean by undermining the target heart rate? If I am to exercise at the target heart rate of 120, maximum heart rate formula can give me the heart rate of 100, meaning that those 20 beats per minute on top have gone for nothing, meaning that we tend to undertrain our patient rather than what do you call it, optimally train the patient. Therefore, giving you a lower target heart rate is like undertraining you. It's better you give a higher, what do you call it, target heart rate. Then they now said, okay, they will now come up with a formula They will now take care of the heart rate and the fitness level. Okay. Now we have a new formula. Let me go to the new formula. Okay, let's do some calculation here. Remember we said we should come with our calculator. We should come with our calculator and our paper, because today we are going to calculate a lot. They said, the first question, find the target heart rate for 28-year-old male using heart rate max, meaning that maximum heart rate formula, if he is to train at 50 to 60%. They said we should find, or we should calculate the target heart rate for a 28-year-old male using maximum heart rate formula if he is to train at 50 to 60%. Remember, the formula requires only your age, and the individual is 28 years old. When we say 220 to get maximum heart rate, when we say 220 minus age will now be equal to 220 minus 28, which is equal to 192 beats per minute, meaning that the maximum heart rate for this Ogada is going to train is 192 beats per minute. Then remember, they give us lower and higher limits of the target heart rate for the exercise. They said the lower limit should be 50 and the upper limit should be what? 60. Therefore, remember we said lower limit is for 50% is 50 over 100. That means it's going to give you 0.5. Then times the maximum heart rate, which is going to give you 192 times 0.5. You can see we got the lower limit is what? 96 beats per minute. Then the upper limit is 60%, which is going to be 60 over 100, which is going to give you 0.6 times the same 192, which is going to give you 115.2. In essence, what they mean here is that individual doing exercise with you should train using the target heart rate between 96 and 115 beats per minute. What they mean is that when somebody is on the treadmill, as he keeps moving gradually, the heart rate may be changing from 70, 80. By the time the heart rate reaches 96, you have already reached the target heart rate. Then you now keep increasing the speed gradually, until when he reaches 110, then you now leave it. For some time, you now see the individual will now be moving gradually at the same speed, getting to 112, 13, up to 14. It may plateau at 14. Then the individual will now be swinging from 92 to 115. That is what is required for him to exercise. Then the next is the heart rate reserve formula. We have hope. Let me go back. Please, members, hope we really understood using the heart rate maximum formula, because we are going to solve some problems. Hope we understood using the maximum heart rate formula. All we just need to do is just calculate 220 minus age times what we got is the maximum heart rate. They are going to give us the exercise intensity, either 50, 60, 70, 80. Then we now use lower and upper limits, and then we now multiply by we now multiply by the maximum heart rate, and we get our training heart rate. Okay, the next is Carbonian formula. Look at the formula the way it is. Target heart rate, which is THR, target heart rate is equal to maximum heart rate minus resting heart rate times training percent. This percent is meaning what? Training percent. Maximum heart rate minus resting heart rate times training percent. Then outside the bracket, meaning that it's on its own, plus heart rate rest, meaning that resting heart rate. Please, what we mean by HRRES, heart rate rest, resting heart rate, meaning that our formula of 220 minus H is still here. Heart rate max is maximum heart rate. Is the same thing as 220 minus rest. Look at resting heart rate, meaning that it's important if you are calculating using heart rate reserve formula, you should also know the resting heart rate of the patient. Now, if I ask you, please, what is the components of this formula that actually account for the fitness of the individual. Remember, the first formula we said, maximum heart rate formula, age predicted maximum heart rate formula actually has problem because it does not determine, it does not utilize the fitness level of the individual a given intensity. But we said this particular formula utilizes the fitness of the individual. Then which parameter now in this formula is the determinant of the fitness of the individual for this program? Can somebody tell me? Which parameter in particular determines the fitness level of the individual when using heart rate reserve formula?
Heart rate rest.
Yes, it's heart rate rest, the resting heart rate. Yes. When one is, you can always get this because there are two ways to get the fitness level of the individual. The first one is the resting heart rate, and the second one is the recovery heart rate. Therefore, somebody who is sick, I used to see patients with stroke. When they come, you measure their blood pressure and we measure their heart rate. You see the heart rate is 100 beats per minute. They are not fit. They are 100 beats per minute. When you check, please, those of you, after this class, go and check the heart rate of Usain Bolt, the heart rate of Tyson Gay, whatever, all these printers, the heart rate of JJ Okocha, they will tell you what is their heart rate. Somebody will now be having heart rate of only 50 beats per minute. You think he's nowhere, he is more fit than you. He has a large heart. The heart pumps blood through peripheral circulation only once at rest. Enough blood into circulation at rest. And there is less peripheral resistance because the heart does not encounter resistance because the blood vessels are patterned. There is no occlusion of blood vessels by what? By cholesterol. They are patterned because of the exercise. They will just pump once and rest. But our heart is small. We pump small, come back, no rest, pump again. We are pumping, the heart is small and pumping against what? Resistance. That is what is happening. Resting heart rate is a determinant of and also recovery heart rate. Let me give you an example. Some people will run marathon. You probably used to see Olympics. Some people will run marathon. You that is watching them, you may even be tired watching them, but they are still running for almost 30 minutes or 1 hour. But when they come down, they will just bend as if they want to pick something. After 30 seconds or so, they will raise their head and begin to talk. How many of us will run 100 meters and be able to talk after that one? Some of us will remain for 30 minutes, breathing heavily. That is to tell you that we are not what? Fit. But if you are able to do exercise at high intensity, coming back to only just take 1 minute of rest and you are normal, that means you are what? Fit. Remember this, resting heart rate and recovery what? Heart rate from exercise, they are determinant of what? Fitness level of the individual. Okay, therefore, for resting heart rates, then what is this heart rate reserve? You can see the one in bracket. Maximum heart rate minus resting heart rate is what you call what? Heart rate reserve. Now observe, when the resting heart rate is small, like 50, and the maximum heart rate is big, like let's say 170. If we say 170 minus 50, what remains? Is 120. Meaning that this guy has higher heart rate reserve, meaning that he can go places. But if you have very low heart rate reserve, let me give you an example. Your age is 50. Therefore, your maximum heart rate is 220 minus what? 50, that is 170. And your resting heart rate is 100. When we said 170 minus 100, what will it give you? 70. Somebody who is of younger age and have lower heart rate has a better heart rate reserve than you. Is that also? Then he is more fit than you. That is another factor again. Another factor of getting what? Heart rate, fitness level is what? Heart rate reserve. The larger the heart rate reserve, you get somebody like Usain Bolt who is having, let's say, the resting heart rate of, let's say, 50. Resting heart rate of 50. And maximum heart rate of, let's say, because of his age, he's probably 30, 220 minus 30 will give you 190. 190 minus 50 will give you around 130. Then compared to somebody who is at the same age, which is on board, who is at the same 30 years, but his resting heart rate is 100. Then we have 190 minus 100 will give us what?
90.
190 minus 100 will give us 90. Can you compare 90 and 130? Then the gap is much. Then this one is more fit than the other one. The larger heart rate reserve means what? Better fitness level.
More fitness.
Remember, three things are important. Heart rate reserve, the larger the heart rate reserve, the difference between what? Heart rate max and resting heart rate is good. Then we now have the rate at which you recover quickly from an intensive exercise is a sign of what? Fitness. Then lower heart rate level at rest. If you now take people in your class or take your colleagues, resting heart rate, and the person with the lowest resting heart rate is more fit than any other person. Okay, then we now have the training percent. Then let's move. Now, look at this question. Remember, please, let me go back if you are observing me. Look at this guy. A 28-year-old, we say we should calculate his target heart rate. Is a male who is 28-year-old, and we say we should calculate target heart rate using what? Maximum heart rate formula. And we said to train at 50 to 61%. And what we got is 96 to 115 beats per minute. Kage about the lower, score for target heart rate. Then observe this. We said the same 28-year-old male in previous example, but he has resting heart rate of what? 70 beats per minute. I think that is the average heart rate of the individual, resting heart rate of the individual, except if you are sick. The average is around 70 beats per minute. Is that so? And exercising at what? 50 to 60%. They say we should calculate the target heart rate using the HRR formula. Then what is required for us is we have to get the, resting heart rate. Look at heart rate max is 220 minus 28, 192 like the other guy. Go. Resting heart rate is 70. Heart rate reserve is what? 192 minus 20 is 170 is what? 122. This guy is what? This guy is fit. Any heart rate reserve that give you up to 100 and above, it means that you are fit. Then the intensity is what? 50 to 60%. Remember our formula. Look at the formula here. Maximum heart rate minus what? Resting heart rate times what? Training percent in the same bracket. Then heart rate rest is what? Outside the bracket. We don't add it until at the tail end. Okay, look at this. Remember, we have already calculated maximum heart rate minus resting heart rate. Look at this, the heart rate what? Reserve. HRR is maximum heart rate 192 minus resting heart rate 70, which is going to give us 122 beats per minute. Therefore, in the formula, we don't have to repeat it again. We only have our 122. Then times the training percent, which is what? We are going to start with the lower limit, which is 50. Then 50 divided by 100 will give us 0.5. Is that also? Then when we say 122 times 0.5 plus 70 is going to give us 131. Then for the upper limit, the same 122 for HRR will now be brought here times 0.6, which is 60 divided by 100, plus the 70 that we have will give us 143. Then if you compare with that 192 and 115 and 131 and 143, which one give lower training intensity? The other formula give lower what?
Formula.
Yes, that is why we said it undermines the target heart rate. It undermines your ability to train your individuals very well. Therefore, the other formula actually is better for use when one is recuperating from an illness. This guy is recuperating from an illness. You may want to start him with a formula that gives lower value. As he is improving, you can recalculate the formula and give him the one that gives what? Higher value. Or most especially elderly patients. They want to start, you just use age prediction maximum heart rate formula. If you just give them lower level, you now start from that place. As the fitness improve, please recalculate using what? The heart rate max. But usually, if it is a young person coming to lost fat in his body, why are you using what you call it? Predicted maximum heart rate formula. It has a disadvantage. It gives lower target heart rate, meaning that it gives lower what? Exercise intensity. Therefore, you use the one that will give optimal exercise intensity for training. You can see, therefore, you can see the target heart rate is between 131 and 143 beats per minute. 131 goes with the 50% and 143 goes with what? 60%. Okay, The next is we pick our pen and paper. Classwork number 1. I will be reading, then you now write it, or you observe it on the screen. Let's see how we calculate this one ourselves. You can see our answers. I have already given the answers. I just want you to get the answers the way I got them.
Yes. Oh. Yes, times 50%. 2%. Oh. Mm. 50. 178. 6 times 170. Mm, 2, 2 times 7. 2, 1, bit per minute. Sure. After it wakes up, we'll be
Okay, are we done?
almost.
Almost. Okay. They say we should calculate what do you call it? The target heart rate using H predicted maximum heart rate formula, and the second one using heart rate reserve formula. We have calculated and we gave the answer.
Yeah.
Okay, did anyone go to the first one using H predicted maximum heart rate formula?
Yes.
What did you get, please?
Okay. The first one is 102 beats per minute
Yes.
to 119 beats per minute.
That is for the H predicted. Okay. Anyone that got H predicted the way she got it? Please.
Yes, I got the same answer too.
Okay, so then the second one.
Yeah, the second answer is 132 beats per minute to 141.5 beats per minute.
Yes. Okay. Meaning that the way at least we are able to get this one, because what is happening is we are going to go somewhere where you are going to see the essence of coming to having this presentation is we are exercise experts, but at times WHO, at times American Heart Association, American College of Sport Medicine will now give recommendation, and we'll now be looking at it. What does this one mean? How do we now translate into using this one for our patients? There's something is missing. We are trying to see if we can fill the missing gap. Okay, then can we, anybody that did not got the same answer?
Yes. Hello.
Okay,
I think I didn't get the same answer.
Which one did you missed? Is it the H predicted or the HRR?
In the Carbonic formula.
Is the Carbonic formula you didn't get, go?
Yes.
Okay, now let's do it like this. Remember, the individual is 50 years old. Is that not so?
Yes.
Then the maximum heart rate. Remember, it utilizes also maximum heart rate. Heart rate max, that's the maximum heart rate is 220 minus 50. That will give you 170, is it?
Yes.
Did you get that one?
Yes, yes.
But for the individual, I did not get it.
No, I get 220 minus 50.
No, not 120, 220 minus 50.
Yes, 220 minus 50. I get
that
that
gives
one.
you what? 170. Go.
Yes, 170.
Then remember, there is another component of the what do you call it? The equation that says heart rate reserve is equal to maximum heart rate minus resting heart rate. Is that also?
Okay.
Remember, we are able to calculate maximum heart rate now as 170. Is that also?
Yes.
Then what about the resting heart rate? Is it not 70?
Yes, it's 70.
Then you now write HRR is equal to 170 minus 1.
75.
No, resting heart is 75.
Okay, 170 minus 75 will give you what?
95.
170.
Were you able to get 95?
Yes, 95.
Okay, then you are now bringing it back to the formula. For the lower level, remember we said we are training at 60 to 70. Is that also?
Yes.
Then for 60 is 0.6, go?
Yes, 0.6.
Times what?
Times 95.
Your HRR. What is your HRR?
That is the maximum heart rate.
No, heart
that
rate
is
reserve.
170.
Not 170. Remember
95.
we have, it's 95, go?
Yes, 95.
Then you have 0.6 times 95, then plus your resting heart rate, 70. You first
75.
You have to first calculate 0.6 now.
75.
You said?
Plus 75.
What did you get?
No, the resting heartbeat is 75 in the equation. Oh, we
yes,
are
the
not
resting
going
heart
to
rate is 75.
Yes.
You miss a step, go?
Yes, I missed it. Yes,
Yes,
what I want to do is 95 times 0.6.
Yes, what is that one?
75
then you now add it to 75.
Okay. And that is where I missed. Thank you, sir.
Then the other one is 95 times 0.7, then plus 75.
Yes, thank you. I think I got it.
You have gotten it back?
Yes, sir. Thank you.
Okay, let's move. Another classwork.
Okay.
Look up here. You have to be vigilant. A 24-year-old male client tells you during his last treadmill training that his heart rate was 145 beats per minute, meaning that this is the training heart rate.
Hello, sorry, sir. Hello.
Hello?
Hello, sorry, sir. Hello.
Hello, I'm with you.
Sorry, sir. Sorry to take you back a little bit.
Okay.
This lower limit, 95 times 0.6 plus 75.
Yes. Plus 75.
I got 132. I just need to.
Yes, that is the answer now. 132 beats per minute. That's 132.
Okay, but in the answer you put 119. I don't know.
That one is for maximum heart rate.
So,
remember the A part, you have A and B part of the question. The A part is you say we should calculate for maximum heart rate formula. The answer is 102 to 119 beats per minute. Then for B part, for the heart
Okay. I've gotten it.
formula,
I got it.
132 to 141.
Yes.
Hope you are not confused.
I'm all right now. Thank you.
How many credits is that?
Then the next question, the next assignment. Okay. Four-year-old male client tells you during his last treadmill training, his heart rate was 145 beats per minute. He wants you to calculate and tell him the intensity of his training using HRR. Is 145 beats per minute, and his resting heart rate is 60 beats per minute. And then the person, and he's 24 years old, and this person says that he wants you to calculate for him what is his training intensity. I have gotten the answer as 62.5%. I cannot always get it. Somebody will see. Okay, are you able to get the answer? individual says
Yes, sir.
Okay, you are able to get 62.5%.
Yes, sir.
Okay, then let's wait for others. Okay, are we able to get it?
Yes, sir.
So more and more got it.
Yes, sir. Yes.
Okay. For the last time.
I try to stand up. You saw the woman now. Did you enter the fight?
Huh? I didn't enter.
Okay, you enter the room.
Yeah.
Just check the room number and come back.
No, I asked the nurse, they give me, then come and give it to you. But why she not stand?
Okay, I think we are done with this one. Then here is another one. Please, let's talk. Who amongst us is unable to get this one? This particular what do you call it, classwork. Hello? If everyone got his chicken, we don't have a problem. Hello?
So we can proceed, sir.
Proceed, sir.
And let's go to another classwork. A 38-year-old man weighing 170 pounds have a resting heart rate of 60 beats per minute. Calculate the target heart rate using H predicted maximum heart rate formula. Determine the target heart rate. You determine the target heart rate for HRR formula at 60 to 75%. It's the same. Therefore, let's see, for those that were able to solve this one, I know we are done. 38-year-old man weighing 170 pounds, have a resting heart rate of 60 beats per minute. We are requested to calculate the target training heart rate using H predicted maximum heart rate formula at 60 to 75%. We have to also determine the target heart rate using HRR formula at 60 to 75%. And they say the answer is for HRR, we have 133 to this, but for H predicted, I did not give the answer. Therefore, calculate, let's hear. Let me calculate also. Wani yana tambaya ko? Na ce, kamar wani yana tambaya ko? Okay, I'm back. Did you really get the answer? Tell me your answers.
Yes, sir.
Okay, what are the answers?
Using the age predicted, I got 109.2 bits per minute to 136.5 bits per minute.
109.
Yes, 0.2 bits per minute. Using the age predicted.
Okay.
Yes. I wanted.
That was the same thing I got.
136.5 bits per minute.
136.5.
109.6
It's correct.
136.5.
It's correct. Forget the one I saw here is what do you call it? Is rounded up. 136 is around 140. The one is 136.5 bar. 136. Yes,
I
it's
got
rounded.
the
It's
same.
136.5. Yes.
Yes.
109.2, then 136.5.
Yes, it's correct. My system, what do you call it? Okay, who did not get it? Okay, everybody got it, ba?
Yes, sir.
Yes.
I got it.
I got it.
Yes. Then the other one.
The other
133.2
one, 133.2.
0.2 to 151.5.
151.5.
Then who is having
Yes.
problem getting it? Some people have gotten it though. That means we are done with this class one.
Sir, I have a question. Oh.
Okay.
Please. I'm sorry.
Okay.
Sir, I have a question.
Okay.
Yeah, I got it. I have a
Okay,
question,
you got it,
sir.
ma? Okay, I'm with you.
Yeah, the classwork before this one. I'm really sorry to take you back. The classwork before this one. Please, sir. I didn't get the calculation. Yes, I didn't get it.
Okay. Okay. Can you put your formula?
What is the formula? The formula for this.
The formula is heart rate reserve times training percent plus resting heart rate.
Can you
Heart
show
rate
me the
reserve?
slide for the formula, sir? The slide.
Okay. The slide for the formula is, look at it here. Can you?
Okay, I can see it now.
You have maximum heart rate minus resting heart rate times training percent plus resting heart rate.
Okay.
Are you able to copy it?
Yes, I got it.
Okay, now in this particular formula, is the guy's age is 24 years old, but
Yes.
you know maximum heart rate will be 220 minus 24. 220 minus 24. What did you get?
Yes, sir. 20 minus 24. 196.
196. Okay, are you done with that one?
Yes, I'm done. We can go ahead, sir. I'll
Okay.
do it later. I don't want to
Okay.
take the class back.
Yes, therefore, when you get this one, you minus the resting heart rate, which is 60. Then what in the formula, what is missing is just the training percent. Already you know the resting heart rate is
We can go on, sir. I don't want to delay the class.
okay. Sorry for the little hitch. Somebody is raising hand. Omar Bello. Yes, I can see a hand up. Any problem? Omar Bello. Okay, let's continue. Before us is classification of physical activity intensity. Actually, there is no single consensus on the classification, the classification of exercise intensity. You can see the classification by Fletcher et al. And Bull et al. Maximum, you can have light intensity, very light, moderate, hard, very hard. I think we have talked about what do you call it? Rating of passive exertion. And then what I want to introduce here is VO2 max, using what do you call it? Heart rate max, and then using metabolic equivalent. But we are going to really look at metabolic equivalent in metabolic calculation. But the most important thing is look at the VO2 max. They said anybody with VO2 max less than 20 is sedentary, light between 30 and 39, moderate between 40 and 49, hard between 60 and 84, very hard between 85, and then maximum. Therefore, this is a classification by Fletcher et al. That Fletcher et al. Is the work of what do you call it? American Heart Association. Then look at heart rate max. This is another classification of heart rate max. Look at it. They said heart rate max. Anybody with maximum heart rate less than 35% for exercise is sedentary. If you give somebody between 35 and 54, it's very light. If you give somebody between 55 and 69, is moderate. Meaning that 55 and 69% of the maximum heart rate is moderate. Between 70 to 89 is hard, meaning that it's high intensity. Then anything greater than 90 is very hard, and maximum is 100. What they are saying is, if I ask somebody to exercise at less than 35% of his heart rate max, is very light, I give him. Anybody I exercise between 35 and 54 is light. Anybody I exercise between 55 to 69 is moderate. Anybody I exercise between 70 to 89 is hard, meaning that is high intensity. Then we have 90 extreme intensity, and then we have 100% is maximum intensity. And then that is why when we talk about maximum exercise, when we talk about submaximal and maximal exercise, anybody who is approaching 100% of his heart rate max, then is approaching maximum exercise intensity. Therefore, most especially for our patient, we target 50 to 69% of heart rate max, or 30 to 54. Then later we move to 55 to 69. Then for metabolic equivalent, until we reach metabolic equivalent, then we now see what it means. But for now, for VO2 max and all these ones, we are going to get them. Then look at another one. This table is from Norton et al. This is very, very important. This is very, very important. Everything that we did, this is where you get summary. Everything we did, this table summarizes everything that you need to know. Everything as physiotherapists we need to internalize in our minds. Everything that should remind us that we are exercise experts is here. Number one, they said, who is sedentary person? Anybody who you are exercising at less than 1.6 minutes, at less than 40% of heart rate max. Anybody who is at less than 40% of heart rate max is sedentary. Anybody who is exercising at less than 20% of heart rate reserve is sedentary. Anybody who is exercising at less than 20% of VO2 max is sedentary. But the most important thing to look at where we used to start as physiotherapy is moderate exercise intensity. Look at moderate, where you have that color. Is it somehow not very red? I don't know. Do we call it orange? No, that is not orange. Somehow. We have anybody who is exercising between 3 and 6 minutes, which we are going to look at later, is moderate. Anybody who is exercising between 55 and less than 70, but of heart rate max please, of heart rate max is moderate. Anybody who is exercising between 40 and less than 60% of heart rate reserve is still moderate. Anybody who is exercising at less than 40 and less than 60% of VO2 max is moderate. There is something I want you to observe. For each table, wherever you see VO2 max and you see heart rate reserve, you see the value is the same. Look at under sedentary, less than 20 heart rate reserve, less than 20 VO2 max. Look at under light, less than 20 from 20 to less than 40 heart rate reserve, from 20 to less than 40 VO2 max, the same. Look at for moderate, from 40 to less than 60 heart rate reserve, from 40 to less than 60 VO2 max, the same. Look at for vigorous, from 60 to less than 85 heart rate reserve, from 60 to less than 85 VO2 max. What it means is that whatever you calculate using heart rate reserve is the same thing. You don't have to calculate VO2 max for your patient all the time. That is why exercise testing, you must say you have to press your patient to do Bruce treadmill tests in order for you to calculate the VO2 max. The value you get for the VO2 max is the same thing as heart rate reserve. Therefore, why waste the patient time? Why subject him to strenuous exercise because you want to do exercise testing on treadmill or on bicycle ergometer using Asran and Redmin? The value you get for heart rate reserve is synonymous with what? VO2. Therefore, if you are exercising somebody at 40 to less than 60% of heart rate reserve, is the same thing as 40 to 60% of what? VO2 max. Don't waste your time. But it's not the same thing as what? Heart rate max. Heart rate max is less than for moderate is between 55 and less than 70. But for VO2 max, and you can never get VO2 max until you subject somebody to what? Exercise testing. Okay, that is what they said. Therefore, for each activity, like for moderate activity, they gave us the activities that we should do. Then look at it. For rate of passive exertion, where you have the what do you call it, between 6 and 18, the moderate exercise intensity is 11 to 13, and between the one that is revised 0 to 10 is 3 and 4. But we said others have our other ratings. Okay, now we are going to look at some terminologies for what do you call it, resistance training. Hafiz, come and give me the terminologies for resistance training. Terminologies for this. Nake jin yana ci ko? Yana cikin file din. Where is the file again? Open it first. Which one? Na zaben da shi. Okay, babu terminologies for resistance training. Bari mu ba shi. Okay. And then, hello. Okay, we are going to finally, in this particular module, before we move to another one, we are going to look at strengthening exercises terminologies. I actually got this one from a what do you call it, American College of Sport Medicine publication. I felt that when we are discussing, everybody knows aerobic exercise, and then even the what do you call it, the what do you call it, the last table I show you is like more of aerobic exercise that is depicted on that particular table, and we talk less of what do you call it, strengthening, especially for our clients. And I feel that we should revise some of these strengthening exercises. They said we should choose at least 10 major muscle groups. And then what I found interesting is some at times there are terminologies. The terminologies they use in describing these exercises, I felt that we should just revise them a little. Okay. For strengthening exercises, we are going to start with machine abdominal curls, curl-up exercise, and diagonal curl-up. Meaning that for somebody who is doing exercise, if one of the group of muscles that we have chosen, they are abdominal muscles. Therefore, the terminologies for them, we have machine curl-up, we have the curl-up, and we have what you call the diagonal curl-up. Okay, this is the first picture. Okay, this is the machine curl-up. The individual, what do you call it? It's like it's like exercising, like extending the spine, then coming forward. That is what they call the machine curl-up. Observe the what do you call it? The stop here at the what do you call it? The shin. He has a stop at the shin that actually prevents his leg from coming into extension. Then he moves the body back, then forward. In that, the what do you call it? The individual is able to strengthen the abdominal muscles. We call it machine curl-up. Then look at the curl-up again for abdominal muscles. Just as if the same position, the patient assumed to perform what you call it bridging exercise. But instead of lifting the buttocks, the individual is what you call it is encouraged to lift the head. He lifts the head towards the knee joint. Then you now have what they call the curl-up for abdominal exercise. They are part of the 10 exercises that they say we should choose to do apart from the resistance training. Therefore, if you are doing exercise or if you are taking drugs or what do you call it, dieting to reduce weight, one way of what do you call it, doing exercises and interspersing the exercise with diets, what do you call it, regimen, is for you to turn up the muscles and your skin so that you don't have a sagged skin. Then look at this, what you call diagonal curl-up. You can see diagonal curl-up. The individual now lift the head as if he is lifting the shoulder towards the knee joint, but actually one of the shoulders is brought forward and the other shoulder backward. Then you can use it for the other side. This is for abdominal muscles. Then we now have for the gluteals, the quadriceps and quadriceps strengthening. Most especially, this targets the hello. Okay, we have the gluteal, what do you call it? Strengthening muscles, strengthening exercises for the gluteal muscles. The gluteal muscles actually can be strengthened alone, but the exercises here can strengthen the gluteal muscles again together with the quadriceps. They involve using machine leg press. We now have dumbbell squat. You know dumbbell, the what do you call it, the little weight we use in the gym. We lift it to do bicep curl-ups with it. Then we have ankle weight, hip flexion and extension exercises. These ones, we should also be mindful of the terminology they use. This is ACSM terminology, machine leg press, dumbbell squat. We have ankle, what do you call it, weight, hip flexion and extension exercise. Okay, this one is the leg press. Therefore, probably we may find it in our gyms. The multi-gym may come with a leg press, but I know leg extension is usually always accompanies, or what do you call it, our multi-gym. This is leg press. Therefore, the first picture is the initial picture A, and the second picture is the final picture. This is meant for, what do you call it, both the quadriceps and the gluteal muscles. Remember, we take it quadriceps and gluteal muscles strengthening. Then look at the second one. You can see the first position is A. The individual is in standing position. Look at the dumbbell in her hand. Then she moves down and then come up. It strengthens both the gluteal muscles and both the gluteal muscles and what do you call it? The quadriceps muscle. Then look at the last one. Remember, we talk about, go back, look at the names. Dumbbell squat is what you saw. We have the machine press, the dumbbell squat. We have the ankle weight, hip flexion and extension. This is the first one. We have hip extension and what do you call it? Exercise, knee extension or hip extension exercise, or leg press. Then the second one, we have what do you call it? The dumbbell squat, you can see. Then the third one, hip flexion and extension exercise. Look at it. You can see the hip flexion, but it goes together with the knee flexion. And then what is on the leg of the woman is what do you call it? Is ankle weight. You can see the two legs. They look like what do you call it? A shin guard or ankle weight, but they are actually, they look like socks, but they are ankle weight. This is the knee flexion. Then look at the hip extension exercise using the ankle weight. Therefore, you can put weights on the leg. They advocate that when you prescribe exercise for somebody who is losing weight, you should also find time to do what? Strengthening exercise to turn up the muscle. Therefore, these ones are for both the quadriceps and gluteal muscles. Then we now have for the legs again. This one are specifically for quadriceps. They don't involve what do you call it? The hips. We have the machine leg extension, the machine leg extension, and then we now have the ankle, the weight ankle, what do you call it? Ankle weight knee extension. Then this is the machine extension. Nearly all our what do you call it? You either have quadricep bench or you have this on your multi-gym. Nearly all the departments have. If they have multi-gym, they have this. Usually it comes along with it. This is the leg extension. You can use a quadricep bench. You can also use it. 8,400 times 2. Yeah, 16,800. Go. Okay, again. 84 times 2. Okay. 16,800. Go. Okay. Then remember, look at this. Just remember your quadricep bench. Look at this ankle weight knee extension. You can see she sits on a chair. You now apply ankle weight. You can apply your, what do you call it? Your what is this way that we use? Sandbag. Yes, we can apply it on the leg. This is part of it. They say we should choose at least 10 major muscle groups that want to exercise. Therefore, for STSM, I found all these pictures and one of their publications. This is part of it. Then we have for hamstring. Please, we are done with the quadriceps. They gave us the machine leg extension and ankle weight knee extension. This is the machine leg extension. The A part is the initial and the B part is the finishing. Then we now have machine leg curl. Machine leg curl. And then we have ankle weight knee flexion. Then look at it, machine leg curl. The leg curl, this is the initial positioning, meaning that the leg is in extension. Then you now use force to bring the leg back into flexion. You are exercising the hamstring. The initial positioning is extension. You use force to bring it back to what? Flexion. Then look at this. The starting position is standing. The individual has ankle weights. You can use sandbag. Then you now ask somebody to what? To flex the leg. As the individual is flexing, you are lifting what do you call it? A weight. The quadriceps is working against gravity, with an external load. Then the next is exercise to quadriceps. We are please exercise to the chest muscles, most especially the pectoralis, and then the triceps. Therefore, in trying to exercise the pectoralis muscles, the chest muscles, you are likely also going to train the triceps. Therefore, the example of what do you call it? Exercises include leg press. We have machine leg chest press, dumbbell chest press, band seated chest press, and modified push-up. Therefore, I'm going to see all of them. This is the machine chest press. We have it in our multi-gyms. Therefore, the initial positioning is the two shoulders are open, as if you want to embrace. Then finally, you bring them together. Then this is the machine chest press. The arms are open as if you want to embrace somebody. Then you now close up in the middle. That's one. Then the next is dumbbell chest press. You can see it. The dumbbells are in the hand. Hello? I know Alaikum Salam. So send a presentation, send me text message. Hello, can you hear me? We are together.
Yes, sir, we can hear you.
Yes, we have the machine. You have it. The individual is lying on the bench, and then you have the two dumbbells in his hand. These ones are much bigger. The initial positioning A is where the hand is. What do you call it? The elbows are bent. The final position, and you can see somebody supporting him so that he does not release the two weights on his hand. This is dumbbell chest press. Therefore, you use that to exercise both chest muscles and the what do you call it? Hamstrings and the triceps. In this position, when the hand is up, the triceps are doing maximal work against what? Gravity. Then look at this guy, band seated chest press. What is this band? This is what we call what? What are these band? What is the full meaning of this band? Is TheraBand. Look at the band. It's cycle around his chest. He holds the band with the two hands. Therefore, the initial position is the two what do you call it, elbows are flexed, and then when he extends. In that position, he also trains the what do you call it, triceps, and also trains the thoracic muscles. If you observe very well, you can see the TheraBand goes around. Let's see, you can see the TheraBand goes around the body, and he holds it. Therefore, when he extends, the triceps are being what do you call it, strengthened, and also the pectoral muscles. Then the next one is modified push-up, meaning that you ask somebody to push the wall. You can see somebody's hand. This is the initial position is A. The final position is what? B. Ask somebody to push the wall. Therefore, you are exercising the serratus anterior and the rest. Please, just give me 1 minute. I know. Okay. The next is back muscles, most especially latissimus dorsi. You know, latissimus dorsi is a climbing muscle. Therefore, any muscle you want to exercise, the latissimus dorsi is a climbing muscle. If you want to climb, holding on to somebody to climb up is you use it. Therefore, we have okay. For back muscles, we have the latissimus dorsi muscle and the biceps muscle. Therefore, we have what we call the lat pull down. Lat pull down is as if you hold something and bring it down. That is a lat pull down. We have machine seated row. What we mean by row is like you push somebody towards you, just like somebody wants to fall into water and you just catch him and pull him towards you. That is the row. Then we have dumbbell arm row and back seated row. All whenever you hear rowing, pulling something back. Then we hear whenever you hear lat pull down, pulling something from up down. Then we now use those to what? Strengthen the latissimus dorsi, the strengthening muscle, and then the biceps muscle. Okay, let's see the pictures. Okay, this is lat pull down. Can we see the picture? Somebody look at it. That's all we have it in our multi gym. It's up there. When you now pull it down, as you are pulling, there is weight behind. You just be pulling down. That is meant for what? It's a strengthening of our latissimus dorsi muscle. Then we now have, look up, observe this one is machine seated row. Look at it. There's something is forward, and this guy is what? In the second picture is pulling it towards him, and that thing have weight. That is another one. Then the third one is observe. He is using dumbbell arm row. It's like trying to push something. It's like picking dumbbell from ground and lifting it up from down, lifting it. Yes, that is the row. Then look at it. A band seated row. Whenever we hear band, we use what? Terra band, or we use what do you call it? Elastic band. Look at it. It is hung into her leg, and she keeps what? Pulling it back. Therefore, they are meant to strengthen latissimus dorsi and the biceps, because everything you do is just combination of pulling down, pulling back, the biceps and latissimus dorsi. Meaning that it's not just that every exercise must have to do with the physiotherapist asking the patient, what do you call it, doing it himself. You can also all have these instruments, and then the patient can be doing all the exercises. Then the next is shoulders, deltoid exercise. Hi. Somebody will say, what about reciprocal pulling? Deltoid exercise, we have overhead press, dumbbell lateral raise, and dumbbell arm or band upright row. Whenever we hear row, we say we pull towards us back. Then, okay. Then let's see the exercises. This is the overhead press. You can see it. The beginning is A, where you start, then the ending is what? Up. Meaning as if you are pushing something up. Remember we said the lat pull down is from up down. But this one is machine overhead press is what? From down up. Then that is for deltoid muscle. Then we now have dumbbell lateral raise. You can see it. But what differentiates dumbbell lateral raise and the other one where you embrace? For the shoulder muscles, remember you can start with arm open and you make embrace where your hand as if you want to clamp. But this one is just you raise sideways. It's meant for also what? Shoulder muscles. Go. This is dumbbell lateral raise. Okay. Therefore, the most important thing is I want us to take care of the terminology that are used by ACSM. Then we can have dumbbell upright row. Remember, whenever we say you are pulling towards you is the row, you can see the starting position is what do you call it? 2 hands by the side. Then you are now lifting, but with the elbows raised. This is what? Meant for shoulder musculature. Then we have band upright row. You can see. Look at the bands. What he does is the 2 bands. When he presses the middle of the band with his 2 legs, and then he now keeps lifting it. Then still a row. Let me allow you see. Look at it. He stand in the middle of the band, and he lifts it. It's still a row. Then finally arms, biceps. The other ones is not specific for biceps, but in the process of doing one exercise the biceps. But this one is purely for biceps. We have what you call the machine biceps curl. We have the dumbbell biceps curl and the band biceps curl. Look at this. This is for the machine. Look at the individual holding a metal. Yes, this is specifically for biceps curl. Then this is for dumbbell curl. And finally for what? For the band curl. Then we now move for the triceps alone. We have machine triceps press, dumbbell triceps extension, band triceps extension, and push up. Okay, this is for biceps press. The initial position is in the bench position. Then we now move to what? Extension. Then you can see this is similar to the other one I told you, where you're exercising the shoulder. Is that also? Yes. This is the same dumbbell triceps extension on bench press. You raise it, somebody will support you so that you exercise the triceps. It's almost the same. Then observe this guy, band triceps press. Look at the band in the hand. She holds one part of the band from behind, then extend this one. That's the tricep extension. You can exchange arm. Then look at it, push up. Yes, you can do that. You can do push up the way soldiers used to push up 10 times, 20 times. You are exercising the shoulder muscles and at the same time exercising what? The triceps muscle into extension. Then low back, erector spinae. We want to go into what? Low back. The first thing that should come to our mind probably is bridging. You can start with bridging, erector spinae muscle. But look at this guy. We have what you call the front plank. The starting position is A and the finishing position is B. You want it to be strong. And the last one, just like for people that know what do you call it? These exercises for back pain. What do you call it? What is it? Cat and camel exercises for back pain is meant to strengthen it. Is that also? You can do that. Therefore, with this, I felt that it's an obligation for us to revise the strengthening exercises that we can give patients. They say we should give at least 10 exercises targeting what? 10 different group of muscles. With this, at least, we can always have exercises handy depending on where we want the exercise to work. Cool? We thank you. And I think we are going to have little rest before we come back to start metabolic exercises. Thank you for listening.
Thank you, sir.
Thank you, sir.
Thank you,
Thank you, sir.
Thank you, sir. We appreciate.
How many minutes rest? How many minutes rest are we going for a break?
For the break, I want to pray and take some food, probably 30 minutes, since we are behind schedule. Go.
Okay, sir. Thank
Don't
you.
waste time.
30 minutes is good, sir. Yes, 30 minutes is okay.
It's okay. Then I will just eat and just pray, then come back.
Okay, sir. No problem, sir. Thank you. We are grateful.
52, 30 minutes. Thank you, sir.
I think we can start. Good. Okay, we are all welcome. The second session is about to begin. We are going to look at metabolic calculations. We are going to come back 30 minutes. This is around 32 minutes past. Therefore, hope everyone is back. I'm going to look at metabolic calculations. Therefore, remember in our previous slides, we talked about metabolic equivalents. We started highlighting metabolic equivalents. We are now going to enter deeply into metabolic calculations, and then they are going to really be meaningful to us. Therefore, by way of introduction, Hafiz mutane sun dawo da wuri? Okay, we have some definition of terms that we are going to look at. The first is what they call maximum oxygen consumption, and the second one is the relative oxygen consumption. The third one, the way it is, what do you call it? When they said maximum oxygen consumption of VO2 max, it means maximum volume of air taken in, transported, and utilized by the body during exercise. And they said, by definition, it cannot be exceeded despite increase in the work output. Okay. Here they said maximum oxygen consumption is the volume of air taken, transported, and utilized by the body during exercise. And they said, by definition, it can never be exceeded despite increase in work output. And actually, this is very true. One of the criteria for reaching, what do you call it, maximum exertion, maximum, what do you call it, oxygen consumption is denoted by plateau of oxygen consumption with increase in workload. Therefore, despite the fact that you increase the speed of, what do you call it, of movement, you increase the speed of treadmill, for example, or bicycle or meter or running, when somebody reaches the peak, what they observe that the VO2 max will never exceed. The amount of oxygen will remain stable. It will just be flat. You cannot go below your maximum, above your maximum oxygen consumption. They said in the clinical practice, exercise tolerance test maximal is not routinely conducted, but VO2 max is usually estimated from peak work intensity achieved. That is a maximal exercise. What we mean here is, remember, in the introduction to exercise training, we talk about maximal exercise and submaximal exercise. Though before we reach that one, we talk about what do you call it? Exercise, what do you call it? Predicted intensities, and we talk about exercise testing. What we mean by predicted equations, or where you predict the intensity of exercise, is where you use some equations to arrive at what do you call it, VO2. That is the intensity. But where you directly measure VO2 in terms of exercise testing, it's not of actually clinical relevance to us physiotherapists, because we are not interested in putting patient to do maximal exercise until he says he is exhausted, because most of the patient cannot do that. But we can only infer the maximal exercise through what do you call it, the use of regression equations. We subject them to maximal exercise, meaning that exercise training testing can be either maximal or submaximal. Exercise testing can be maximal or submaximal. If it is maximal, that is where you subject apparently healthy individual, people that want to go for what do you call it, that clubs that want to buy players, they subject them to maximal exercise intensity so as to know their real VO2.
But for us, for patient, you don't have to subject somebody with heart disease to VO2. Yes, you subject him to some maximal exercise. Then with that one, we are going to then use some equations to arrive at the maximum. Therefore, they said in clinical practice, exercise tolerance test is the maximal exercise testing is not routinely conducted. At times, you may need clearance from medical doctors. At times, some medical doctors will have you part of the team, most especially cardiologists. Why do you have to undergo this? Some maximal test does not require all these things, and you can infer the maximal from the result of a maximal test. Okay. Then another definition of term is what we call absolute oxygen consumption. This is the rate at which oxygen is consumed by the whole person. Therefore, if they are looking at the amount of oxygen I consume during exercise in liters, they will tell me yesterday you utilized 2 liters during your exercise. The so days you utilized 5 liters during your exercise. They are looking at the amount of oxygen I utilize during the exercise in liters per minute. That is as person, as what you call it, the whole person. The relative oxygen consumption is the rate at which oxygen is consumed relative to body weight. What they mean is that, let me give you an example. There are some drugs that they will give you, they will say 10 milligram per kg, or let's say 1 milligram per kg, meaning that if the boy is 10 kg, you are going to give him 10 milligram, because every 1 kg you give 1 milligram. If the individual is 50 kg, meaning that for every 1 kg, there is 1 milligram, meaning that if somebody is 50 kg, then he's going to get 50 milligram. The same thing as this. Relative oxygen consumption is the rate of oxygen consumption relative to body weight. Therefore, if I consume 2 liters, then what is the amount of oxygen I consume relative to my weight? That is the relative oxygen consumption. And it's usually in mil per kilogram per minute. Mil of the oxygen I take per my body weight per the time I spend doing the exercise. And they said it is a volume of oxygen consumed per kilogram of the body weight every minute. That is what they call it, relative. Absolute oxygen consumption is usually identified by the unit called liter per minute. Wherever a question is raised, a question is being asked, and then if we see liters per minute, we know what the question is meaning what it is used in the question, in the formulation of the question is liters per minute and is absolute oxygen consumption. Wherever we see mil per kilogram per minute in a question, we mean whatever is used in the formulation of the question is relative oxygen consumption. Okay, the next is metabolic equivalent. What is MET? M-E-T, MET, metabolic equivalent. They mean the energy equivalent expended by an individual while seated at rest doing nothing. Therefore, if I sit in my house doing nothing, I am just watching TV, the energy I'm expending is equal to 3.5 mil per kilogram per minute. And it's equal to 1 MET, 1 MET, because 1 MET is 3.5 mil per kilogram per minute. Therefore, 1 MET is the caloric consumption of an individual at complete rest. Therefore, if I am not doing anything, I am just resting, just enjoying myself, doing nothing. Therefore, my energy expenditure at that particular moment is 1 MET, and it's equivalent to 3.5 mil per kilogram per minute. Okay, now metabolic calculations. Now, this is very important. If we didn't hold this one, we are not really going to make any progress. Holding these equations are very, very paramount and important. There is a relationship between absolute oxygen consumption and relative oxygen consumption. There is a relationship between absolute oxygen consumption and relative oxygen consumption. The formula is relative oxygen consumption is equal to absolute oxygen consumption times 1000 divided by body weight. Absolute oxygen consumption, relative oxygen consumption is equal to absolute oxygen consumption times 1000 divided by body weight. Then, while if you want to use absolute oxygen consumption as subject of the formula, then we now say absolute oxygen consumption is equal to relative oxygen consumption times body weight divided by 1000. Then remember, there is one big formula, and this formula has to be highlighted. With this formula, you can solve so many problems. And I have I'm trying to highlight the formula now. Yes, this is the formula. VO2 divided by 3.5 mil per kilogram per minute is equal to MET. Therefore, when you calculate VO2, which we are going to look at later, when you calculate your VO2 and you divide by 3.5, is going to give you the value in metabolic equivalent, meaning that metabolic equivalent is the total amount of the fitness level divided by 3.5 mil per kilogram per minute, meaning that VO2 is over 3.5 is equal to mil per kilo is equal to MET. Therefore, then we now have what we call net VO2. Net VO2 or VO2 reserve. We call it what? Net VO2 or VO2 reserve. Remember in our previous example of heart rate using heart rate reserve formula, we said maximum heart rate minus resting heart rate is heart rate reserve. It's the same thing with VO2 reserve. Maximum VO2 minus VO2 as rest, because resting heart rate and they're resting at rest. Therefore, 3.5 mil per kilogram per minute is the VO2 of somebody who is at complete rest. Therefore, we said net VO2 or VO2 reserve is equal to VO2 max minus 3.5, meaning that the value of VO2 at maximum minus 3.5 mil per kilogram per minute. And then that is the VO2 reserve. Okay, remember we said something, we are going to come back to it. This is very, very important and paramount. The issue of absolute and relative oxygen consumption. They are not the same. Relative oxygen consumption is equal to absolute oxygen consumption times 1000 divided by body weight. And we said absolute oxygen consumption is equal to relative oxygen consumption times body weight divided by 1000. We're going to look at this. Therefore, we now have some conversions. When we say you want to convert to 1 mile per hour, please treadmill speed come in mile per hour, come in kilometer per hour, and you come in a mile, what do you call it, meters per minute. But actually, the most acceptable is mile per hour and kilometer per hour or meters per minute. Therefore, 1 mile per hour is equal to 26.8 meters per minute. The same way, 1 mile per hour is equal to 1.62 kilometers per hour. And then 1 kg is equal to 2.2 pounds. IB is pounds. Therefore, 1 kg is equal to 2.2 pounds. Okay. Please, we should take note of these conversions. They are going to be very, very important. And another thing we are going to introduce is, ACSM calculation, which actually use meters per minute. And then we need to convert the speed always from mile per hour to meters per minute when we are doing calculation. Okay, now we are starting with metabolic calculations now. They said we should calculate the absolute oxygen consumption equivalent to 10 meds for a 70 kg male. The answer is 2.45 liters per minute. Therefore, members, calculate absolute oxygen consumption that is equivalent to 10 meds for a 70 kg male. Remember, we said meds. We have said it. VO2 divided by 3.5 mil per kilogram per minute is equal to what? MET. Therefore, what we are given here is we should calculate the absolute oxygen consumption equivalent to 10 meds for a 70 kg male. Please try. The answer is 2.45 liters per minute. Remember, we have given formula for calculating absolute oxygen consumption, we have given formula for calculating relative oxygen consumption. Therefore, can we calculate and see if we can get 2.45 liters per minute? 2 minutes. Okay. How many of us got the answer? 2.4. Remember, let me get back to your question. These are the formulas. Absolute oxygen consumption is equal to relative oxygen consumption times body weight divided by 1000. Absolute oxygen consumption is equal to relative oxygen consumption times body weight divided by 1000. Absolute oxygen consumption equals to relative oxygen consumption times body weight divided by 1000. Okay, how many attempted? Are we together?
Yes, sir.
If you are
Please,
unable
sir,
to
can you
get
show
it,
the formula again?
look at it here. I have highlighted. Absolute oxygen consumption, absolute O2 consumption is equal to relative oxygen consumption times body weight divided by 1000. Then remember, VO2 divided by 3.5 is equal to METs. VO2 divided by 3.5 is equal to METs. Another 1 minute. Let's see how we can get it.
Please, sir, can you display the slide for the question?
Okay, let's see the slide for the question. Calculate absolute oxygen consumption equivalent to 10 METs for 70 kg male. If you try, well, you are unable to get it, then we solve it together. That's true, we are able to. Okay, are you able to get something? Yeah? Are you able to get it? You are unable to get it. Okay, now let's see how we can solve it. Let's solve it here. Solution. Okay, can somebody give me if he's able to get it?
Yes.
Okay, what did you get? You get the 2.45?
Yes, sir.
Okay, how did you arrive at it?
Well, I use the VO2 over 3.5
is equal to 10 MET. So I use that to get my VO2.
Okay, so now look at
and
it. Somebody is telling you the first formula to use is VO2 divided by 3.5 is equal to MET. Therefore, remember our MET is 10. Is that not so? Therefore, when we say VO2 divided by 3.5 is equal to MET, it's just like say VO2 divided by 3.5 is equal to MET over 1. Therefore, we now cross multiply. MET will multiply 3.5 will be equal to VO2. Is that not so?
By 2.85.
Yes, therefore, this should be the answer now should be VO2 is equal to MET times what?
Okay, times
3.5.
3.5. Okay.
Therefore, how many METs do we have? 10, which is equal to 10 MET times 3.5 will give you what? 35. 35. But 35 is relative VO2. Any VO2 you see here, VO2 is relative. 35 mil per kilogram per minute. So the next is we have already gotten our VO2. The next is to get what? Our absolute oxygen consumption. Oh, absolute O2. Absolute O2. And then what is our formula for absolute O2? VO2 times what? Body weight divided by
1,000.
1,000. Then it's now equal to VO2 times body weight will give us what? Remember our body weight is 70 kg. We now said 35 times 70 divided by what? 1,000.
1,000.
Yes, what is the answer?
1,000, not 100.
You said?
35 times 7.
3,450.
Okay.
Okay, 2.45.
2.45. I think, yes, the person that got it right has helped you. Therefore, two formulas are important here. We are giving MET. Whenever you hear MET and you don't know VO2, you already know VO2. Because VO2 divided by 3.5 will give you MET. If you have given MET, Baba, you don't know VO2, you don't have any problem because you already know MET is 10. When you multiply by 3.5, you are going to get your VO2. Therefore, because the formula for absolute oxygen consumption come with what? VO2 times body weight divided by 1,000. Since we know body weight, we know we have 1,000. The only thing we don't know is VO2. And the formula that link VO2 and MET is VO2 divided by 3.5. You can easily get it since we know the MET. I think this one is solved, huh? Okay, here is the next one. Solve it. I'm not going to solve this one since I solved the first one. We solved the first one together. Okay. Now, the absolute oxygen, the absolute VO2 max, of a 45-year-old male weighing 53 kg is 2.028 liters per minute, meaning that the absolute oxygen consumption is this. What is the relative oxygen consumption?
The
They
question
have already
again.
given us the absolute. What is a relative what?
Come again, sir.
The absolute oxygen consumption.
Yes.
Of a 45-year-old female.
Yes.
Weighing 52.3 kg is 2.028 liters per minute. Then what is her relative oxygen consumption?
2.02 liters per minute. Okay.
Remember, our relative oxygen consumption is equal to absolute oxygen consumption times 1,000 divided by body weight. Go back to our formula. This is the formula for what? Relative oxygen consumption is equal to absolute oxygen consumption times 1,000 divided by body weight. Absolute oxygen consumption times 1,000 divided by body weight. Relative oxygen consumption is equal to absolute oxygen consumption times 1,000 divided by what? Body weight. Therefore, this is cheaper to get than the other one. Go. Therefore, you calculate. Already, you know the body weight, you know the absolute what? Oxygen consumption. Is that so? All you just need to do is you insert some things and you get the answer. Remember, all you just need is to just put in the formula. Absolute oxygen consumption, relative oxygen consumption is equal to absolute oxygen consumption times 1,000 divided by body weight. You don't need to convert anything. Straight, you just get your answer.
I've gotten the answer, sir. It's 38.77.
You have gotten. Yes.
38.
Let's wait for other people to get. Let's see what other people get. It's 38.77629. And we have to be doing it fast because there are more important things to do. We did not do exercise on treadmill. We did not do exercise on bicycle ergometer. We did not do calorie calculation. We did not do weight loss.
Okay.
Okay, how many did not get it?
Gotten it.
Did you get it?
Yes, sir.
Okay, then other people, I should put the answer.
So I've gotten my answer.
You have gotten. Remember, the equation is absolute, no relative O2. Therefore, let's say ANS, answer, ANS. We have relative O2, O2, O2 is equal to absolute O2 times 1,000 divided by what? Body weight.
Times body
already
weight divided by 1,000.
Times
body weight.
45.3.
You said?
Times 52.3 body weight.
Yes. Therefore, we
Divided
have
by
absolute oxygen consumption times 1,000 divided by body weight, which is equal to, we have 2.208, like this one, which is equal to something like
The
this.
sound is not coming up again.
Are you not seeing it? Times 1,000 divided by our body weight is 52.3. When we do that, we are going to get 38.77629.
Yes.
Therefore, we are done with this one. We have solved it. Then let's move to another one. Okay, now, hope we are done with this one because they will come back. There are some questions when you enter your bicycle ergometer or your treadmill calculation, most of these guys are going to come back. Okay, we are now going to enter another phase of the work. ACSM equations. Equation VO2 for walking, VO2 for running, and VO2 for stepping. VO2 for walking, VO2 for running, and VO2 for what? Stepping. They are like that. If one is walking, how do you calculate his VO2? If one is running, how do you calculate his VO2? If one is stepping, how do you calculate his VO2? Okay, it is simple. Look at the formula, but remember, the way you see bracket, that is the way you use the bracket. VO2 for walking is equal to 0.1 times speed, all in bracket, plus 1.8 times speed times gradient, all in bracket again, plus 3.5. VO2 for walking is equal to 0.1 times speed in bracket plus 1.8 times speed times gradient in bracket plus 3.5. Then we have VO2 for running. The VO2 for running is 0.2 times speed in bracket plus 0.9 times speed times gradient in bracket plus 3.5. Let me repeat again. VO2 for running is equal to 0.2 times speed in bracket plus 0.9 times speed times gradient in bracket plus 3.5. That is for running. Then for stepping exercise, if you ask somebody to do stepping exercise, like using step bench or staircase, therefore the first step of the staircase, then we can calculate VO2 for stepping, or you are using a stepper. Therefore, the VO2 for stepping is equal to 0.2 times step rate in bracket plus 1.33 times 1.8 times height times step rate in bracket plus 3.5. Let me repeat. VO2 for stepping is equal to 0.2 times step rate in bracket plus 1.33 plus times 1.8 times height times step rate in bracket plus 3.5. Okay, now if we are able to write this one, now let's go back to the calculation. We are only in slide 9 of 34, and each slide has a work to be done. Now, they said, what is the treadmill speed? Okay, let me come back. Let me explain these formulas.
Okay.
This formula, the speed here is in meters per minute. The speed here is in meters per minute. I remember when we start this work, I showed you that if you are given speed in mile per hour, 1 mile per hour is 26.8 meters per minute. Therefore, the speed originally from ACSM come with meters per minute. That is the speed they use. Therefore, if you are given any speed in kilometer per hour, in mile per hour, you have to convert it to meters per minute. I remember we said 1 mile per hour is equal to 26.8 meters per minute. That is the speed. Then the middle part, where you have 1.8 times speed times gradient. The gradient is the inclination. When one is walking on treadmill, and you now raise the head of the treadmill, there is something you touch. The head of the treadmill will now begin to go up. You go up as if it is in angle of elevation. Then the gradient, if the gradient is 10, then you say 10 over 100, that is 0.1. If the gradient is 1, 1 over 100 is 0.001. Then if it is 5 over 100 is 0.05. That is it. Then we now have, then the 3.5, the last component is a constant, which is the, the amount of oxygen consumed by individual at rest. That is the last part, that is 3.5. That is the interpretation. Then if the speed is on bicycle ergometer, it will now be in form of revolution per minute. When we get to that place, we cross it. Okay, now let's go. They said walking. We are now taking calculation for walking. They said, what is the treadmill speed? What is the treadmill speed required for a young person aged between 20 and 39 years to attain a target intensity of 4.8 to 7.1 meters without inclination? Please, when we are calculating, and we do not say there is inclination, meaning that the middle part of the equation where you have gradient, if gradient is 0, anything times 0 is 0. Therefore, wherever you have gradient, if the gradient is 0, then the middle part will be 0. Therefore, they said we should calculate the treadmill speed required for a young person between the age of 20 and 39 years to attain a target intensity of 4.8 to 7.1 metabolic equivalent MET without inclination. Therefore, we said solution. Remember, we said they can look at it. This question, this particular equation is for calculation of relative VO2. Is for calculation of what? Relative VO2 direct. Therefore, now remember we have absolute VO2 in liters per minute. But these ACM equations, they are for calculation of relative VO2 for individuals that are either walking, running, or stepping. We have that of bicycle ergometer, we have that of treadmill. Therefore, here we said, what is the treadmill speed required for a young person, age 20 to 39 years, to attain a target intensity of 4.8 to 7.1 MET without inclination? Now, the most important thing is that they gave us MET, but we can always convert MET to VO2. What they are asking us to calculate is the speed. Look at our formula. Each formula has speed. They're asking us to calculate the speed. But they have converted the MET to VO2 to MET. We are to reconvert this one back to VO2. The first thing is to get what? VO2. Remember, we said VO2 divided by 3.5 is equal to MET. But we are giving MET. Therefore, VO2 is equal to 3.5 times MET. Remember, our MET is 4.8 to 7.1. Now, if we take 4.8, that is the lower MET. We have 3.5 times 4.8 will give us 16.8 mil per kilogram per minute. Meaning that the VO2 for somebody who is working at the lower pace of the MET, that is 4.8, is 4.8 times 3.5, which gives us 16.8. Then we now come to where you have VO2. You can see it where I am highlighting. Where you have VO2. VO2 now is 16.8 mil per kilogram per minute. Look at it, we have 0.1 times speed. The S is speed. Already we don't know the speed. Plus 1.8 times speed times gradient. We don't know the speed and the gradient is 0 in the middle. Then the last one we have 3.5. Therefore, the whole of the middle part will be 0 because our gradient is 0. Remember they said without inclination, meaning that the gradient is 0. We are working on flat surface. Therefore, the middle part will now be 1.8 times speed, but times 0. Since the gradient is 0, then the whole of the middle part is 0. What remains for us is 0.1 times speed. Then remember, look at this 3.5. It's plus 3.5. If we want to take away this plus 3.5 to another side, it will now become minus 3.5. Look at it, is 16.8 equal to this. Now we move 3.5 to the other side of the equation. It will now be 16.8 minus 3.5. We now leave 0.1 times speed. Therefore, your speed, if you want to get speed, we divide both sides by 0.1 so that we can clear out 0.1 and we get speed. Therefore, when you say 16.8 minus 3.5 is going to give you 13.3. When you divide 13.3 by 0.1, it's going to give you 133 meters per minute. But remember, 1 mile per hour is 26 meters per minute, 26.8 meters per minute. When you convert, the speed is 4.96 miles per hour. The speed is 4.96 miles per hour, meaning that the treadmill speed that will give you 4.8 in metabolic equivalent is what? 4.96 miles per hour. Hope you understand this. Okay? Look at it very well before I move to the other one, because there are questions. And I really want to finish all the slides today. Okay, now working continue. Look at 7.1 MET. Remember, our question says, what is the treadmill speed required for young persons aged between 20 and 39 to attain target intensity of what? 4.8 to 7.1. We are able to deal with what? The 4.8. Then we are moving to what? 7.1 MET. Then we now move to 7.1 mates. Therefore, the upper limit is 7.1 mates. Then they say we should calculate the speed that will give us 7.11 mates. Then remember, our formula said, because we are giving mates, we can always get VO2. Remember, VO2 divided by 3.5 is equal to mate. When you multiply 3.5 by mate, it's going to give you VO2. Remember, we know our mate is 7.1. Then we now say VO2 is equal to 3.5 times 7.1 mate, which is going to give us 24.85 mil per kilogram per minute. Already, when our formula comes, we have already known our VO2. Therefore, our VO2 for working is equal to 0.1 times speed plus 0 plus 3.5. You know the reason why the middle part is 0? Because the gradient is 0. Therefore, we have 1.8 times speed times gradient. Like the way we discussed the other time, the gradient is 0, the middle part is 0. Therefore, now the VO2 is 24.85. We are going to put it here. Look at it the way I highlight. Our VO2 is like this. Then remember what remains is 0.1 times speed in bracket. Then we now have plus 3.5. Just like the way we did with the other one, we are going to migrate the 3.5 plus to the other side so that it becomes minus. What will remain is 0.1 times speed on the other side. When we say 24 minus 3.5 is going to give us 21.35. When we divide both sides by 0.1, we are going to get the speed. Therefore, when you say 21.35 by 0.1, it's going to give you 213.5. But remember, we told you the calculation, as far as we are concerned, is always in meters per minute, the speed. Therefore, for us to get it in mile per hour, we have to convert. 1 mile per hour is equal to 26.8. And you have 2.135 mile per hour, meaning that when you divide 2.135 meters per minute divided by 26.8, you are going to get 7.97 miles per hour, meaning that the treadmill now it will now be running in between, what do you call it, in between 4.96 and what, 7.97. Meaning that in the equation, you can always calculate the speed, you can always calculate the gradient, and you can always calculate what? The VO2. When you have the speed, you have the gradient. When you have the speed and gradient, but you don't have VO2, you calculate VO2. When you have VO2 without speed, you can calculate gradient. Okay, now the next is, hope we really understand this one. We are going inside now. Classwork. 25 years old woman who weighs 130 pounds. 25 years old woman who weighs 130 pounds has a predicted VO2 max of 40 mil per kilogram per minute. Whenever you hear mil per kilogram per minute, it's relative VO2. You decided to run her at 60% of her VO2 reserve. You decided to run her at what? 60% of her VO2 reserve. How fast will you set the speed in mile per hour, assuming zero gradient? Assuming what? Zero gradient. You are on a treadmill, and then you are not inclining it zero gradient, but they said you are to run her at 60% of our VO2 reserve. Okay, let me give you hints. You see that VO2 reserve? Please listen. VO2 reserve here, whenever you see VO2 reserve here, is maximum VO2 minus resting VO2, just like heart rate reserve. VO2 reserve is equal to maximum VO2 max, VO2 max minus what? What is the resting VO2? What is our resting VO2, please? Resting VO2 is 3.5 mil per kilogram per minute. Is that also? Which is equal to 40 minus what? 40 minus 3.5. That is her VO2 reserve. 40 minus 3.5 will give you what? 36.5. Go. 40 minus 0.5. 40 minus 3 is 37. Minus 3.5 is 36.5. This is mil per kilogram per minute. That is your VO2 reserve. But remember, they say you decided to run her at what? 60% of her VO2 reserve. What is the speed that you are going to run her? The final answer is 3.5 miles per hour. Calculate, let's see if we can get it.
21.9.
Okay, how many of us got the answer? You got it?
No.
Why? Okay, if you're unable to get it, then we can solve it together.
Not too hard.
We can solve it together here. Remember our VO2 reserve, just like heart rate reserve. Remember heart rate reserve is maximum heart rate minus what? Resting heart rate. VO2 reserve is the same thing. Like VO2 reserve is VO2 max minus resting VO2. And the resting VO2 is 3.5 mil per kilogram per minute. Therefore, remember her maximum VO2 is 40. Therefore, we have 40, then minus resting VO2 3.5, which is going to give us 36.5 mil per kilogram per minute. Then remember, we said you as a specialist, you decided to run her at 60% of our VO2 reserve. Therefore, the 60% of VO2 reserve will now be 0.6 times 36.5. Please, somebody should press for us. 0.6 times 36.5. 0.6 times 36.5.
31.9.
31.9. 21.9. Therefore, so then that is the VO2. This is our VO2. This is equal to, we now say 60% is equal to 0.6 times that. This is what in mil per kilogram per minute. Meaning that they are telling us to use this particular value to calculate the speed, because they are telling us to use 60% of our VO2 reserve. This is 60% of the VO2 reserve is equal to this mil per kilogram per minute. Then remember our formula for running. For running is equal to what? VO2
0.2
equal to 0.2 times speed. Then we now say here, the middle part is what? We said at zero gradient. We now say plus 0, then plus what? 3.5. Everybody knows why we give it 0, but
yes,
the gradient is 0. Look at it, assuming 0 gradient. Therefore, remember we have, what do you call it? For VO2, we have 29 here. Therefore, we are going to have our 29 here is equal to 0.2. You know how we get the 29 bar? 21.9 bar? 21.2. Yes, times our speed, then plus 3.5. Then for us to get our speed here, we now said we have to take this 3.5 across the equal sign. Then we now have 21.9 minus 3.5 will be equal to 0.2 then times our speed. Then when we have something like this, then the next is we want to get the speed. We now say 21.9 minus 3.5. What is the value, please?
18.4.
You said 18. 18.4 will now be divided by 0.2. That will be our speed.
92.
Is it 18.4, go?
Yes.
Divided by 0.2. What is the answer?
92.
92 on the dot?
Yes.
92. Then remember this one is in meters per minute. Remember the calculation come with meters per minute, go? Then remember 1 mile per hour is equal to 26.8 meters per minute. You have to divide 92 meters per minute by what? 26.8 to convert it to what? Mile per hour. Can you now, this one is in meters per minute. We now say speed. Speed equal to distance divided by 18.4 divided by 0.2, which is equal to this. Then we now say speed in m mile per hour is equal to 92 meters per minute divided by 26.8. What did we get?
$3.4.
You said 3.4.
Yes.
So you can see how we got the answer. Then hope we are going to get the next one. At least we are able to do this one together. Then let's see how we can get therefore speed. Therefore, this speed is in mile per hour, the one that it comes with, and they ask us to calculate the speed in meters per minute and in mile per hour, because you hardly see a treadmill with meters per minute. It is the ACSM equation that comes with what? Meters per minute. At the tail end, you have to convert it to either mile per hour or this, and the answer is 3.4 mile per hour. Okay, now let me get another question for you using walking, stepping, calories calculation. Work example. Okay, I gave only one example here, but hope you are able to understand it. Hello? Hello, hope we're able to understand this calculation so that we move to another one.
Yes, sir. Yes, sir.
Okay, So then we are going to move to another calculation. The next one is what do you call it? Stepping. Okay, there is something with stepping. I think I want to, yes, for stepping, let me play a little video for you to see what I mean in the stepping, and then we now continue. Okay, Hafiz, wannan video zai iya nuna shi? Okay, na riga na buɗe shi. Show the video. Okay. Ai ba ka ɗauka ba. Yana kai already. Ya zan ƙara volume. That's it. Baya fita? Baya fita? Okay. So how will they get the volume? Da za a ƙara volume ɗin nawa. Amma suna gani? Suna. Okay, what we have here is when we are using either bicycle ergometer, because we are going to come to it, or what do you call it, step bench, the most important thing we should understand is we are going to use a metronome, except if we are using sophisticated bicycle ergometers that do some automatic calculations. If we are the ones that will do some calculations, and again with stepping, we have to use a metronome. But if we have sophisticated bicycle ergometers, then we don't have to use a metronome. But this is very, very important. What I'm showing here on the video is a metronome that one can actually put on his, you can download from Google app. Then you now put on your system, on your phone, and you can easily use it because it makes beep sound. It will tell you, one good thing with the metronome is that there is beeping sound. The beeping sound, if it beeps 4 times, if you are working on bicycle ergometer, that means you divide the total number of beeping by 2. Because when one leg is down, the other leg is up. When you turn it in such a way that the leg that is down comes up and the leg that is up comes down, you did halfway. That is half cycle. Until when the other leg now return to original position, that is a full cycle. Therefore, when you are following the metronome, you have to divide the beeping of the metronome. That is, if it beeps 100 times, then if you are on bicycle ergometer, then that means 50 revolutions per minute. But if you are stepping is a 4-phase activity. If you are on stepping, you step first on your right leg, then the left leg will follow. Then that is you have done halfway. Then the right leg that first come up will now go down. Then the left leg will now come follow it. Therefore, until you have 4 steps, 2 going on, then 2 coming down, you don't have one until you have, that is when you will have 1 step. Therefore, if you have beeping 100 times for metronome, then it means 100 divided by 4. That means your step rate is 25 steps per minute. But if it is a cycle ergometer, when you have 100 beeps, then you divide by 2. That is 50 revolution per minute. Okay, I tried doing something here, though the voice is not coming out, but I'll keep explaining. This is my phone, and I kept saying, you can see this is the metronome. I on it. Yes. This is at the speed of 300, beats per minute. Yes, the metronome now is reduced to 100 beats per minute. Then we now on it. You can see it's making beep sound. Yes. You can see this is 100 beats per minute. On bicycle odometer is 50 revolutions per minute. Revolutions per minute. We can increase it to 120. This is the beep has increase in speed, and this is 60 revolutions per minute. If you divide by 2, if you are on bicycle ergometer, that is 60 revolutions per minute. We can add increase to 140. This is 70. This is 70 revolutions per minute. That is around 140 beeps. Okay, the next is we are going to see the practical application of this one in the lab. I have a participant that is sitting down. This metronome has been set as 60. We are telling him that each movement of his leg should follow the beating of the metronome. And we are starting with 60 revolutions per minute, and we keep increasing the speed. We tell him whenever the beep sound makes, he moves the leg. It is now making sound din, 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 60 revolutions per minute. Therefore, we move it to 70 beeps per minute. That is 35 revolutions per minute. 70 beeps, that is 35 revolutions. Din, din, din. We are moving to 80 beeps per minute. Din, 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 din. This is 80 beats per minute, which is around 40 revolutions per minute. Din, 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 din. The speed is being increased now to 90 beats per minute. Din, 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 din. Now to 100 beats per minute. Din, 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 din. We are moving to 110 beeps per minute. Din, 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 din. The speed is increasing. We are now at 100. Moving to 150 revolutions per minute. 100. This is 60 revolutions per minute, which is around 120 beats per minute. Din, 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 din. Now we are moving to 130. That's 65 revolutions per minute, 130 beat per minute. You can see the speed is increasing. Ding, 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 ding. 140 beats per minute now. Ding, 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 ding.
At 140 beats per minute.
Okay, we are moving to now 150 beats per minute, which is around 75 revolutions per minute. Now it's increasing. Now to 160. This is 160, around 80 revolutions per minute. If you divide by 2, you can see the individual is now moving faster. And the metronome is making sound. Ding, 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 ding. Then we are moving to around 170 now. Okay, now is the stepping exercise. We are done with the bicycle ergometer. We can see how we use the metronome we keep increasing the speed of the beeping of the metronome, and the individuals follows it. Now we are going to use, but remember, in bicycle ergometer, the total number of beeping, if it is 100 beep per minute, then we divide by 2, that is 50 revolution per minute. But in stepping exercise, what is required of us is whatever number of beeps. If we have 100 beeps, then it's equal to 100 divided by 4. That will give us 25, steps per minute. Somebody will say, how do we divide by 4? The issue is you have 2 legs. When the right leg goes onto the step, the bench, that is quarter. Then the left leg will now follow it. That is half. Then when the right leg come back, that is 3/4. When the left now finally come back, when you come back, then when the two, that means full. 2 legs must be on top when you are going, and 2 legs must be down when you are coming down. That is what makes what? One, step rate. One step rate is a 4 phase activity. Therefore, this is what we are going to demonstrate here using a metronome. Therefore, the participant is ready, facing a step bench, and we want to use our metronome. Let's see. What we are saying here is the stepping is a 4-part activity. We have to divide whatever number of steps we take divide by 4. It's going to demonstrate to us. Okay. Yes. What we are saying also here, the speed, but the participant is going to move is also going to be determined by the metronome. The metronome has been set at 120 beats per minute. Therefore, the individual is now going to be instructed to take the step. That's the one of the activity up. Then he has done halfway, 3/4. That is one cycle. That's quarter. This is half. This is 3/4. This is a full cycle. 4 steps make one cycle. Therefore, if he takes, if the metronome beats 100, he's going to divide by 4 so as to get 25 as step rate. Therefore, the metronome is beeping now. This is at 80 beats per minute. Ding, 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 80 beats per minute. We are moving to 90 beats per minute. Ding, 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 90 beats per minute. Then we are moving to 100 beats per minute now. Then. The metronome is the one that is setting the pace. It is just following us. Then. We are moving to 110 now, beats per minute. Then. We are moving to 120. We are moving to 130. 140 now. 140 beats per minute. You can see as the metronome is increasing in speed. Yes. Therefore, this guy is at 140 beats per minute. Then the cadence is, this individual is at 140 now. The cadence is the total number of steps now taken divided by 4. Then we said 140 divided by 4. That is what is going to give us the step rate. Yeah, thank you for listening. Okay. So now the sheet. Okay, okay, now members, we have played a little video. Though I'm going to send the video to you. There is audio on the video, but actually I know you cannot hear it. That is why I kept repeating. Any energy expenditure on stepping exercise. For stepping activity, the knowledge of step height and the step rate, step per minute, is required. But one thing with the step per minute, if you are using a metronome, it's a 4-part activity. If the metronome beeps 100 per minute, then you have to divide that 100 per minute by 4. That means the step rate is 25 per minute. Unlike in bicycle ergometer, when it beats 100, you divide by 2, that is 50 revolutions per minute. And remember, one step is defined as a 4-part activity. That is the reason we have to divide by 4, and I show it on the video. Lifting one leg onto the step, that is 1. Then the other leg right on the step, you have done half. Returning the initial leg down, you have done 3/4. Then returning the second leg down, that is 4-part activity. Then if the target is 20 steps per minute, if you target that individual is going to do 20 steps per minute, then how are you going to set your metronome? Then it is 20 times 4. That means you are going to set your metronome at 80 beats per minute. Such that when you divide 80 by 4, you are going to get 20 steps per minute. It depends on you. Then we said divide 80 by 4 to obtain the step rate of 20 beats per minute. The last guy that was doing the stepping exercise that I showed in my department, he is the final step, the speed is at 140 steps per minute. Meaning that if you divide 140 by 4, it's going to give you, what do you call it? Around 30-something step per minute. That is the number of steps he is taking per minute. That is a step rate. Then they say stepping. To calculate the VO2 for bench stepping, using 16 each bench. Please, there is something we need to understand. We have to convert if they give you any, what do you call it, height on the step bench, If the step bench height is given in inches and not in meters, you have to multiply that inches by 0.4064. And if they give you any step height in inches, not in meters, you have to convert the step height to meters by multiplying the inches by what? 0.464 meters. Therefore, they said, now they gave us an example. They said to calculate VO2 for what? Bench stepping, using a 16-inch bench height at a cadence of 24 steps per minute. They have already given us the cadence. Here we don't have to calculate the cadence. If it were us to calculate the cadence, meaning that you have to say 24 times 4, then you are now going to set your metronome so as to get this one. But this one has already been given to us. Therefore, look at the formula. VO2 for stepping is equal to 0.2 times step rate, which is already given to us 24, times 1.33 times 1.8 times the height of the step. Already it has already been given us as 16 inches. You have to multiply by 0.25 to get it in meters. Then times the step rate again, already they have given us 24 plus 3.5. Then here is the solution. Therefore, remember the VO2 is equal to 0.2 times step rate. You can see here, we look at where I am highlighting. You can see here in this formula, 0.2 times step rate, 0.24 plus 1.33 times 1.8 times what? 0.464 times 24. Therefore, we now have 16 times 0.464. Please, times 16 times 0.464. Where we have 16 times 0.464, we want to convert those inches to what? Meters. Remember, they tell us the height of the step is in inches. Therefore, we are now going to use 16 times 0.464, that is for the height, then times the step rate, the last one, which is going to give us 24 plus 3.5. Then we now have 0.2 times 24 is going to give us 4.8. Then we now have 3.5. The middle part is 1.33 times 1.8 times 16 times 0.464 times 24. Please, let's do the calculation and see if we can get it. Please, can we calculate? Okay, are you able to get it? Let's calculate, please, because I added 16. Hope I'm not mistaken here also. We have 1.33 times 1.8 times 16 times 0.464, 0.4064 times 24, then plus 3.5. This is how we calculate the VO2 for stepping. This is how we calculate the VO2 for stepping. Look at it very well, because we are going to have some, what do you call it, some questions or some class activity. Is it correct? Have we calculated?
It is not correct.
It is not correct. Okay, what is the correction?
Yes.
Because I forgot to write 16 here. That is why
Okay,
I'm asking.
it's 373.60.
Is what?
373.6.
Is it the whole for the middle part?
Yes, for the middle part.
373.
373.6.
You cannot get that one. Calculate again. We have 16 times 0.464, not 464. 16 times 0. It's high. Calculate again. 1.33 times 1.8 times 16 times 0.464. This middle part is meant for the height of the something. Remember we said when the height is given in inches, you have to calculate. When the height is given in inches, you have to multiply by 0.4064. Let's calculate again. 1.33 times 1.8 times 16 times 0.4064 times 24.
Evening, sir. So I think the problem is the 16 inches has already been converted to meter, and you are still multiplying it by 16 again.
Okay.
Yes, that's what I'm thinking
Okay,
about.
Okay, I think it's correct the way I put it before.
Yes.
Yes, sir.
Okay. So let me
Yes.
go back, please. There is something I forgot to give you. Let me go back. There is something I have to give you. The conversion, height conversion. Let me give you. If you forget conversions, then there will be trouble. Okay, what will happen? I think the speed conversion, the conversion is let me get the conversion for you. Okay, divide 16 by 0.4064.
So the conversion for inches to meter is 0.0254 meters.
Okay, so then as well, then 1 inch is equal to what?
0.
That is what 0.0 254. Okay, then multiply 16 by 0.0254. Can you get what we got there?
Yes, sir. It will give you that 0.4 something, sir.
So shikenan, please, they should take note. Please take note of this one. And in this slide, I did not put anywhere where I have this conversion. Go. It's very important.
Yes.
Yes, it's very well. That is what we are missing. The conversion. Therefore, 16 inches is equal to this. Therefore, then with that, this calculation is correct the way it is. Okay,
exactly.
Now, exactly. Therefore, please take note of this 1 inch is equal to 0.0254 what? Meters. Okay. Now, let's go back to this one. Now, stepping. Everybody, now pick your pen and paper. We calculate this. Consider a person who weighs 50 kg, stepping at the rate of 20 steps per minute. On a 10-inch step, what is the VO2 and MET? The answer is here 19.66 and 5.6. Let's see if we can get it. I took 1 hour now. So we took another almost 2 hours. Don't forget the 10-inch that is given to you, the 20 steps, use them direct. But the 10-inch that is given to you, have to convert the 10-inch to what? To meters. We now said 10-inch multiplied by 0.0254 is now going to give us the height in what? Meters. Remember, we have given you the height in meters. Look at it. Let me just put it here. Let me put it in the sentence here. I will say not. Let me put it here. Not. 1 inch is equal to what? 0.05254 meters. So that you can easily get the answer. Okay, are you able to get this? It's easy, you can get the VO2. Remember, mates is equal to VO2 divided by 3.5. Then you just calculate your mates. Go. When you get your VO2, mates is equal to VO2 divided by 3.5 will give you mates. Shikenan, you are done. Then we move to another thing. Did we get the answer? We are still working. Quite a lot of calculations waiting for us. Are we able to get the answer? Zero 0.2 times 20. We now have 1.33 times 1.8 times 10 times this times 24 plus 3.5. Okay, let me have a solution. Let's see. Let's see whom and whom are going to get it together with me. Solution. We have this 0.2 times your step rate is equal to 20 times 1.33 times this times your step height is 10. 10 multiplied by 0.0254. Yes, 254 times then 20. This is what we needed to calculate this. Therefore, we now set our VO2. VO2 is equal to 0.2 times 20. 0.2 times 20.
4.
Okay. Then it's 4 bar. 4. Then we now say plus. Then we now have 1.33. 1.33 times 1.8 times 1.8 times 10 times 0.0254 times
19.66.
19.6 is back.
That's what I got.
Yes. Yes. Whoever
19.
got it, he got right.
Yes.
Whoever got 19.66 got right.
Okay.
We are
19.
still waiting for 19.66. Then remember, this is in mil per kilogram per minute. You have to convert it to MET, and then remember the formula that join MET and VO2 is VO2 divided by 3.5 is equal to MET. Therefore, the value you get divided by 3.5, you are going to get MET.
$5.6.
Yes. So then let others try also.
Okay.
12.1.
5.615.
Then plus 3.5. Then one will have 4 plus 12. So, therefore, we have done the calculation here. For those that did not get it, VO2 is equal to this. Then MET is equal to VO2 divided by 3.5, which is equal to 5.6. For those that couldn't get it, yes, look at it very well. If you're able to get it, shikena. For those that couldn't get it, remember we said 0.2 times step rate. You got it back?
19.66.
Yes. Therefore, the answer is 19.66. Then you now, that is the VO2, remaining the METs.
Divided by
3.5.
3.5.
Yes, VO2 divided by 3.5 is equal to MET.
5.61. Okay.
Yes. Okay, so then the next is we are going to move to calories calculation. From calories calculation, then weight reduction. After that one, we call it a day. Then calories calculation. This is an important, what do you call it, aspect of our calculation. It's very, very important because without calories calculation, we cannot estimate weight reduction. We want to know how many weeks of exercise is going to help this one burn 5 kg of fat. How many weeks of exercise is going to help him burn 10 kg of fat? We have to know this one. Therefore, the first thing is we have to dabble into calorie calculation. What is this calorie? The first thing we have to know, there are some important equations that you have to write. These equations that are on this first, what do you call it? On this first slide, they are very important. Though we have not come to bicycle, ergometer, and treadmill, hope we are going to finish it today. Okay? We said calories is the amount of energy required to raise temperature of 1 kg of water by 1 degree Celsius. But this formula is very important. Look at it. Kilocalorie is equal to VO2 times the body weight in kg times 5 times time in minutes divided by 1000. Please write it somewhere. Kilocalorie is equal to VO2 times body weight times, that is in kg, times 5, that's 5 is constant, times time in minutes divided by 1000. That is kilocalories. If we want to calculate the kilocalorie expended by person, we said VO2 times body weight times 5 times time divided by 1000. That is the kilocalorie. But there is another one that is very, very important. Shini. 1 kilocalorie, what do you call it? Kilocalorie per minute. Because when we come to calculate weight reduction, we use only kilocalorie per minute. The formula for kilocalorie per minute is VO2 times body weight divided by 200. Is VO2 times body weight divided by 200. 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 You know, the VO2, absolute oxygen consumption, has significant relationship with kilocalorie per minute. Because the formula for absolute oxygen consumption is VO2 times body weight divided by 1000. But this one divided by 200 is something, one is 5 times the other one. Therefore, when we come, we are going to calculate. Therefore, the formula that joins absolute oxygen consumption and kilocalorie per minute is absolute oxygen consumption is equal to kilocalorie per minute divided by 5. When you divide kilocalorie per minute divided by 5, you are going to get absolute oxygen consumption. Because if you can remember, if you can flash back, the formula for calculating absolute oxygen consumption is VO2 times body weight divided by 1000. It's almost the same with kilocalorie per minute. VO2 times body weight, but this one divided by 200. Therefore, when you look at the relationship, you combine the two equations together, you find that absolute oxygen consumption has a relationship with kilocalorie per minute, in the sense that absolute oxygen consumption is kilocalorie per minute divided by 5. Okay, we are done. We are going to be revisiting them one by one. Okay, now they said work example. Work example. They said a person who is 65 kg. The person weighs 55 kg, 65 kg, and has VO2 of 51.11 mil per kilogram per minute, meaning that is relative VO2. We are to determine the energy expenditure in kilocalorie per minute. We should determine the energy expenditure in what? Kilocalorie per minute. Remember, there are two methods of getting this answer. We have method 1 and method 2. I'm going to follow the two methods together. Okay, remember they say we should calculate kilocalorie per minute, go? And they give us the weight of the individual they give us the VO2. We are to calculate kilocalorie per minute. And remember, kilocalorie per minute is equal to body weight times VO2 divided by what? 200. Look at method 2. It's the simplest of the two methods. Method 2. Let me take the method 2. Method 2 is, look at it, equation number 2. Don't use 1. I'm going to explain the 1 to you first. Look at it, kilocalorie per minute is equal to VO2 times body weight divided by 200. And that is what we said here. If you go by this formula here, look at it here. Kilocalorie per minute is equal to VO2 times body weight divided by 200. Therefore, the method 2 is the one that is direct. VO2 times body weight divided by 200. What is our VO2? 51.11. What is our weight? 65 kg. Then what is the denominator is 200. Then the answer is 16.61 kilocalorie per minute. 16.61 kilocalorie per minute. 16.61 kilocalorie per minute. But if this is the second equation we are using, which is straightforward, then we can still get the same answer. If we now use, what do you call it? If we now use absolute oxygen consumption, you are also good, because absolute oxygen consumption has a relationship with kilocalorie per minute. Therefore, if we can calculate absolute oxygen consumption, we can easily get kilocalorie per minute. Remember, look at this equation. Kilocalorie per minute, absolute oxygen consumption, look at it here, the one I draw line. Absolute oxygen consumption is kilocalorie per minute divided by 5. Therefore, kilocalorie per minute is absolute oxygen consumption times 5. In essence, what this one is saying, kilocalorie per minute, let me show you, kilocalorie per minute here is equal to 5 times absolute oxygen consumption. It's the same thing. Therefore, the second formula is, we want to calculate absolute oxygen consumption, multiply it by 5 so that we can get, kilocalorie per minute. That was what we did in the second formula. We calculate absolute oxygen consumption, multiply it by 5 without get what? Kilocalorie per minute. That was what we did. Therefore, what we did is we now said, okay, in this real sense, let's calculate absolute oxygen consumption. Then we now said, okay, convert relative oxygen consumption to absolute oxygen consumption. We know the formula. Absolute oxygen consumption is equal to relative oxygen consumption times body weight divided by 1,000. Therefore, we have relative oxygen consumption times body weight divided by 1,000, which is going to give you 3.32 liters per minute. Already we have gotten absolute oxygen consumption. Remember, we said absolute oxygen consumption times 5 is going to give us relative oxygen consumption. Therefore, when we multiply 3.32 times 5 is going to give us 16.60. The same thing you got here is the same thing you got here. The major issue is that there is a relationship between absolute oxygen consumption and kilocalorie per minute. When you divide kilocalorie per minute, divide by 5, you get absolute oxygen consumption. When you multiply absolute oxygen consumption by 5, you get relative kilocalorie per minute. You can also convert relative oxygen consumption the way we are given here in 51 to absolute oxygen consumption. That is all. Hope we are not confused. Okay, now let's take an example here. Classwork. Let's pick our pen and paper. A 60 kg man runs at a speed of 9 miles per hour. How many kilocalories will he expend in 20 minutes? The answer is 310.44 kilocalories. Okay, now let me give you hints. The first hint is that you are going to calculate the VO2 for running. But remember, you have to convert 9 miles per hour to meters per minute. 9 miles per hour is equal to 9 times 26.8 meters per minute. Then you insert into the equation. Remember, whenever we are not giving gradient, the gradient is 0. Therefore, now we are going to have 0.2 times speed plus 3.5. The speed is 9 miles per hour. You have to convert it to meters per minute before you put it inside the equation. Then you now said 9 times 26.8. You now get the VO2 first. Then you use the VO2 and put the formula for calculating kilocalorie using VO2. And the formula for calculating kilocalorie, remember we said it. Kilocalorie is equal to VO2 times body weight times 5 times time. Times time. Remember, time is 20 minutes. Then divided by 1,000. No, the other one is kilocalorie per minute. One is general kilocalorie. VO2 times body weight times 5 times time divided by 1,000. Kilocalorie per minute is the one that comes with VO2 times body weight divided by 200. No 5, no time. Look at the kilocalorie per minute. Look at it. VO2 times body weight divided by 200. No 5, no time. But look at kilocalorie. VO2 times body weight times 5 times time divided by 1,000. Therefore, that is the one you are going to use here. VO2 times weight times 5 times time divided by 1,000. And see if you can get this. But the most important thing, you have to calculate what? VO2 using equation for running. And then where is the equation for running? I told you we are still going back to these equations. Equations for running, equation for walking. Look at the equations for running. Look at it. Equation for running is equal to 0.2 times speed plus 0.9 times speed times gradient plus 3.5. But since we are not given the gradient, we assume the gradient is 0. You are only going to have 0.2 times speed plus 0 plus 3.5. Then remember, we can always 0.2 times speed. Remember, speed is 9 miles per hour. You have to convert it to meters per minute because in the equation, in the formula, you don't use miles per hour straight. You have to convert it to meters per minute. Then you said 9 miles per hour times 26.8. It is going to give you the speed. Let's see what is going to happen. Let's see how you are going 310.4 kilocalories. Calculate this. Okay, how many of us got the answer? The first one.
Sir, I got it.
You got 310.44.
Yes, sir.
Okay, what is your VO2?
My VO2 is 51.74.
51.74.
Yes.
Okay. Then let's see how many people are going to get it.
Okay.
My VO2 is 2241.2. While the kilocalorie is 51.74.
Kilocalorie is what?
51.74.
Oh, okay. Let's see where you get missing. I think it's in the VO2 that you made mistake.
I got 241.2 as my VO2.
Okay, 241.
9 times 26.8
Yes.
for the conversion. That's 241.2.
But tell me the formula. We have 0.2 times speed.
2 times 0 plus 3.5.
But
Okay,
you have to convert the mile per hour to meter per minute.
Yes, that is 9 times 26.8.
Yes.
Times
9 times 26.8. Then
times 0.2.
Oh, times 0.2 again.
Yes.
Yeah, the formula says 0.2 times speed.
Times speed, yes.
Yes. 0.2 times speed.
241.2.
When you say 0.2 times speed, like for example, okay, let me start to write it here. When we say 0.2 times speed, then plus, because the middle part is gone, plus 3.5. 3.5. Then this is 0.2 times speed is going to give us 48.24 plus 3.5, because our speed is, then this is equal to 0.2 times our speed is 9 times 26.8. 26.8, which is good. Then plus what? 3.5. Then it's still going to give us 48.24 plus 3.5.
Yes. That's
48.24. 48.24. Then we now have plus 3.5. Then plus 3.5. Then what is it going to give us?
51.74.
We have 48, please. 48.24 plus 3.5. It will give us what?
51.74.
74.
Point.
Yes.
Points. Then put 51.74 times 60 times 5 times the time is 20 minutes. Divide by 1,000. Let's see what we can get.
$310,000. 440.
Yes, 310.44.
Yes.
Yes, that is the answer. 310.44 kilocalories. I hope other members are seeing what we have done, because the gradient is 0. Therefore, we don't have to say it when the gradient is missing. We use the formula for speed, but we now leave the gradient as 0. Just say 0.1 times speed, just like this. 0.2 times speed. Then we now say plus 0 plus 3.5. The middle part is 0. Then we now have 0.6 times plus 3.5. What we got is 311. Then let's look at the other one. A 70 kg male expends 7.5 kilocalorie per minute. Remember, we know our kilocalorie per minute we say is VO2 times body weight divided by 200. While exercising, what is the equivalent VO2? We can easily get the VO2 in this one. This is the simplest of all. What is the equivalent VO2? Kilocalorie per minute, already they have given us 7. Is equal to VO2 times body weight divided by 200. You can easily get this one now. Let's calculate.
The answer is 21.4. We'll just multiply 7.5 by 200 and divide it by 70.
You are able to get it. Then we now have the answer in maths. Can you convert it to maths? Because they said, what is the equivalent math value?
Okay.
We divide it by 3.5.
So let's see what you are going to get.
It's 6.1.
So we are done with this one. Then
0.1.
classwork. Okay, are you got your yes? Then now classwork again. If a 79.5 kg man runs on treadmill at 1% grade, now we are going higher. The middle part will not be 0 now. So let me give you a hint. That 1% grade is 1 over 100. That is 0.01.
0.01.
Yes. At the speed of 6.5 miles per hour, meaning that you have to convert it from 6.5 by what? 26.8, meaning that you say 6.5 times 26.8. But remember, they said for what? 30 minutes. Go 5 times a week. For 30 minutes. 5 times what? A week. They said how many kilocalories each session will he burn based on his net VO2? Please, what is net VO2? Before we miss it. Net VO2 is VO2 reserve. Therefore, when you calculate the VO2, you now have to say the VO2 you get minus 3.5. That is the net VO2. A 79.5 kg man run on treadmill at 1% grade at the speed of 6.5 miles per hour for 30 minutes, 5 times a week. How many kilocalories each session? Meaning that each session is 5 times, i.e. 30 minutes. Meaning that you are calculating kilocalorie for what? 30 minutes only. Each session is for 30 minutes. How much calories will he burn based on his net VO2? And then we said net VO2, don't use the VO2 you calculate for running. You have to say the VO2 minus 3.5, you get the net. That is what you are going to use to calculate the net VO2. And we said it's 14.5 kilocalories. Yes.
I'm not hearing it again. I'm lost. I can't hear anything again.
Okay. Are we able to get it? Okay, I have started imputing the calculation for you. 0.2 times 6.5, that is the speed, but we have to convert the speed to meters per minute. We now say 6.5 times 26.8 plus 0.9 times speed times gradient. The speed is 6.5 times 26.8 to make it meters per minute, then times 0.01. Remember we said 1%, which is 1 divided by 100, that's 0.01 plus 3.5. Whatever you calculate, that is your VO2. But remember we said net VO2 is equal to your VO2 minus the VO2 you got minus 3.5. That is your net VO2. Then you now use the formula for calculating kilocalorie. Then remember the total time per session spent is 30 minutes. Therefore, you now put 30 minutes and see if you can get 14.5 kilocalories. Okay, we have to finish this one and move to another place. Okay, are we done? Hello.
I hello.
Okay, I'm with you.
Okay, so I've done my calculation,
What
but
did you get?
my
Hit us.
kilocalories, I made a mistake somewhere because I'm seeing 434.5. So
Okay, what will happen? Look at my calculation, follow it up and see if we can get the same thing. Look at the calculation I'm doing, then you follow it up. Let's see where the problem is. We can always get where we have little mistake. Go.
yes.
Okay. What is the answer you got?
I got 400 and
35?
yes.
Oh, now.
Is it?
What is, give me the value. 400 and
Four,
something.
yes. Let me open my 439.2.
39.2. Therefore, something like that is correct. Do you know the answer I gave here is kilocalorie per minute here. The one here is kilocalorie per minute.
Oh, okay.
Yes, if you divide that value by 30 minutes that he spent in doing the exercise, divide the value by 30, you are going to get something like that.
Okay, let me see.
Therefore, whatever you calculate, if you divide it and you got almost this is 14.5 or 14.6 is correct.
Yes, it's true. Yes, it's true. It's true. I just got it.
Yes, you got it, Bob?
Yes.
Therefore, the answer I gave is what do you call it? Kilocalorie per minute. Therefore, when you get and you divide by 30, you are going to get kilocalorie per what? Minute. Therefore, please, those hope people have understood. Therefore, forget the answer I give here is kilocalorie per minute. And I think I was rushing and I calculate per minute and I leave. Therefore, the answer is around 400 and something. We have 36.85 times 79.5 times 5 times 30 divided by 1,000. Whatever you got is the kilocalorie. And if you want to get per minute, since the exercise is for 30 minutes, divide by 30. Is that also? When you divide by 30, you get that 14.5 that I gave. Okay, now. Okay, forget the other session. I think the other session may not be correct. The answer, cool? Leave this one. Leave the first one. It's okay. Okay, how many of us got this answer? 439.2 kilocalorie.
I'm sorry, sir. I think there's a mistake in your addition.
Okay.
The 34.84 plus 1.57 plus 3.5. I got 39.91 when I calculated it.
Okay,
39.91.
Okay, now please calculate again.
So,
then, okay.
39.91.
39.91.
Yes.
Okay, I think okay, let's go. 39.91. Okay, yes. Now, then put it in the equation. You are still going to get something like that. 39, because they are very close. We have now 39.91 minus 3.5. Go.
That's 6.41.
39.91. We have what? 36.1?
41.
36.41. Then you now insert 36.41 here into this equation and see what you are going to get. 36.41 times 79.5 times 5 times 30 minutes divided by 1,000. Tell me what you get.
434.19.
434.
Point
what?
0.19.
0.19.
Yes.
Okay, then what you got, you said you divide by 30 so that we get kilocalorie per minute, because this kilocalorie is for 30 minutes. Is that also?
Yes.
If you divide by 30, you're going to get the previous answer I gave you.
14.4. Yeah, 14.5. Yes.
You can see it, ba? Therefore,
yes,
it was
sir,
my
yes,
calculation. I calculate kilocalorie per minute and I left it. 14.5.
Okay.
Cool?
Yes, sir.
Yes. Therefore, your kilocalorie per minute is 14.5. Therefore,
Okay.
no problem, and we are not confused.
No. I was just confused with the addition. That's all. Thank you, sir.
Let's take energy expenditure on cycle ergometer. This is wahala. When are we going to stop? Because we are only on slide 20, and we have to reach slide 34. But we can rush the bicycle ergometer so that we go into what do you call it? Into weight reduction calculation. Then it's a formula you can easily read and understand. Go. This one is the most tricky one, the kilocalorie, the relative, and the absolute oxygen consumption. Let me rush to energy expenditure by kilometer. Hope so many people understand this one, please. Members, so many people hope understood how we got the answer here.
Yes, sir.
Okay, so now we are moving energy expenditure by kilometer. Now, by kilometer, the way we do the step something. Remember how they give you the step rate, you don't have problem. But if you are the one that will get the step rate on stepping exercise, when you set your metronome and it gives you the step, if you are using the step rate of 100, then you have to divide by 4 to give you the step rate that you are going to use. Then, like for bicycle ergometer, if you are using metronome and it gives you the cadence or the step rate of 100, you divide by 2 to get the cadence of 50 revolution per minute. Because you use two legs. If one leg is up and one leg is down, when the right leg that is up turned down and the one that the left that turned up, you have done half. Until when the right leg come back to its former position before you have one. That is why you have to divide by 2 when you have 100 revolution or 120, you have to divide by 2 to get 60 revolution per minute. Okay, they said these are the parameters. This is very important whenever we are calculating anything treadmill, anything bicycle ergometer, anything. There are some parameters they come with. We have that of arm ergometer, but I did not present it here because of time factor. We have 1 watt is equal to 6.0 kilogram meters per minute. Whenever we hear kilogram meters per minute, just the way we used to hear mil per kilogram per minute, we say it's relative oxygen consumption. We used to hear liters per minute, we say absolute oxygen consumption. Is the same thing when you hear kilogram meters per minute. Whenever you hear it, you know it's what we call work rate. Work rate is the same thing as power, but as far as the unit is kilogram meters per minute, we know that one is what we call what? Work rate. No matter whatever they call it, whether power, whatever functional capacity, as far as they say kilogram meters per minute, you know it's your work rate. And one thing with bicycle ergometer, its calculation has to do with the calculation of work rate. And that is a simple calculation. Then we now said you need these things in calculation of work rate. You need resistance. The resistance you put on the bicycle ergometer. Therefore, when you are working on bicycle ergometer and you do the resistance from 1 to 10, it will keep resisting your movement. That is the resistance. Then D, the diameter of the flywheel per revolution. The distance moved by the flywheel per revolution, the diameter of the flywheel. Therefore, like for Tunturi, and we have for Tunturi and Bodyguard is 3 meters, and for Monarch is 6 meters. What they are saying is if you sit on bicycle ergometer and you use that your leg, you now wind the the flywheel. If you wind it once, for a Monarch, it's going to move 6 meters on ground. For Tunturi and Bodyguard, they are going to move 3 meters on ground. That is what they mean here is the distance. Then we have the frequency, or what we call the frequency of revolution, or what we call the cadence on the bicycle ergometer, or the revolution per minute. We all they call them RPM, revolution per minute, or the frequency or the cadence on bicycle ergometer is usually the number of times you rotate the bicycle, flywheel per unit time. If you rotate it 100 per unit time, it's better than somebody who rotates it 50 per unit time. Therefore, it determines how fast you are walking. The resistance is measured in kilopound, P-O-N-D, kilopound, okay? Therefore, we now said calculating revolution per minute. I have already explained this. When you have it, look at the last sentence. For metronome, when you have 100 beats on a metronome, it's equal to 50 revolution per minute divided by 2. Then we now have equation for energy expenditure on leg ergometer. Please, we have arm ergometer. Arm ergometer come with 3.5. Leg ergometer come with 7. Therefore, but we are not using arm ergometer here. We said VO2. Here we have to understand that there are 2 ways of calculating. You can calculate directly using watt, and you can calculate directly using work rate. But equal to 1.8 times the work rate, all the value you get divided by the body mass, just divided by the body weight. But 7 is at the tail end, meaning that 7 is never going to be part of the calculation until you finish this one. 1.8 times what you collect as work rate times body mass. And then remember this other equation. The only way to get work rate, The only way to get work rate are these three factors: resistance times distance of the flywheel times cadence or the frequency or the number of revolutions per minute. Therefore, the work rate is resistance distance times flywheel, meaning that this equation, you can still write work rate here, or you can write the distance times what do you call it, number of revolutions times what, the resistance times work rate times what do you call it, cadence. Then the next, therefore write it please, VO2 is equal to 1.8 times work rate divided by body mass. When it is separate, then you now add 7 to, after you have calculated the left side, then you now add 7 to it. And then we said the only way to get work rate is, we have it here, resistance times the distance of the flywheel times the frequency. That is how we get the work rate. Then let's move to the next. Here we have the worked example. Number 1, they said calculate the energy expenditure of a 62 kg woman cycling at the work rate of 450 kilogram meters per minute. Already the work rate is given to us, and the formula is 1.8 times work rate divided by the body weight plus 7. Remember we said 1.8 times work rate divided by the body weight plus 7. Therefore 1.8 times 450 will give you 810 divided by 62 plus 7. Therefore, this is 13 plus 7. This is 20 kilogram, 20 mil per kilogram per minute. That is, what do you call it? For using bicycle ergometer. Using bicycle ergometer, the calculation of work rate is 1.8 times work rate divided by 62. That is the body weight plus 7. Therefore, 1.8 times 450 will give you 810. Then divided by 62, that is the weight plus 7. Then when you divide 810 divided by 62, will give you 13 plus 7, because you don't add anything until you finish the one on the left side before you add the 7. Okay, now example 2. Okay, a 110 pound woman, that IB is pound. If you want to get weight of the individual in kilogram, you divided the pound by 2.2. Therefore, if you now write 110 divided by 2.2, you are going to get the weight of the individual in kilogram. Therefore, the weight of the individual in kilogram is 50 kg. Divide 110 by 2.2, you are going to get 50 kg. Therefore, a woman who is 110 pounds pedals a Monarch bicycle ergometer. Remember, the D for Monarch is 6, and the D for Tunturi and Bodyguard is 3. At 50 revolutions per minute, meaning the cadence on the bicycle ergometer, she cycles using 50 revolutions per minute, and the resistance is 2.5 kilopounds. They say we should calculate her absolute oxygen consumption. We should calculate her absolute oxygen consumption. Remember, we said the work rate is resistance times distance times cadence. Resistance, look at where I'm going to put my cursor here. The work rate we are going to use in the calculation is not known. Therefore, we are going to use the resistance times flywheel distance times cadence. The resistance already has been given to us is 2.5 kilopounds. Look at it. The distance for Monarch, the flywheel is 6, is automatic. Then the cadence is 50 revolutions per minute. Then when you calculate, it's 750. Then we now come to our formula. 1.8 times the work rate divided by body mass plus 7. Then we now have 1.8 times the work rate, meaning that 1.8 times 750, that is the work rate. 1.8 times 750 will give you 1,350 divided by 50, that is the body mass, then plus 7. Then you are going to get 27 plus 7, you are going to get 34 mils per kilogram per minute. That is the relative oxygen consumption. But remember, the question said we should what? Calculate our absolute oxygen consumption. We are now going to convert absolute oxygen consumption of 34 mil per kilogram per minute to relative oxygen consumption. Remember our formula. Absolute oxygen consumption is equal to relative oxygen consumption, that is VO2, times body weight divided by 1,000. That is the formula. Absolute oxygen consumption in liters per minute is equal to relative oxygen consumption, that is VO2, times body weight divided by 1,000. Therefore, we have our 34 times body weight 50 divided by 1,000, which is equal to 1,700 divided by 1,000, which is 1.7. Therefore, the answer is 1.7 liters per minute. Therefore, go through it again, recalculate and see. If there is no problem, then we move to the next example. Okay, are you done? Did you really understand this one? Hello? Hello, hope we are online. Okay. Did you really understand this one? Go through and see if you are able to understand, then we now make progress.
One lecture then that will
No, I think the calculation is okay, sir.
Okay, so then let's move to this guy. I'm going to give you this one. A 55 kg woman trains on cycle ergometer by pedaling at 60 revolutions per minute against a resistance of 1 kilopound. What is her absolute oxygen consumption? Look at the last answer is 1.36 liters per minute. Let's see who is going to get it. If you want the formula is VO2 is equal to 1.8 times work rate divided by body weight plus 7. 1.8 times work rate divided by body weight plus 7. 1.8 times work rate divided by body weight then plus 7. Don't add the 7 until the end. Then remember we said work rate is defined by, what do you call it, the distance of the flywheel by multiplied by the resistance multiplied by what? The cadence. There is something I did not tell you. Whenever they did not tell you which type of bicycle ergometer, whether Tunturi, whether Monarch or Bodyguard, if they are silent about it, then you use, what do you call it, Monarch, because it's the standard bicycle ergometer. You use D as 6. Thank you. Calculation, let's see if you are going to get it. If you are going to get it. Okay, how far? Are we really able to get it?
Yes, sir.
Okay, no problem. We are able to get 1.36 liters per minute. If we get the VO2, we now convert the VO2, which is relative oxygen consumption, to what? Absolute oxygen consumption. Remember, we said absolute oxygen consumption is equal to relative oxygen consumption times body weight divided by 1,000. That is all. Okay. Anyone who is having problem with understanding this other one, if you are able to get the other one, then we can easily get this one. Okay. Now, the last part, weight reduction. I think if we are able to finish weight reduction today, we have done a lot. Cool. Weight reduction. We as physiotherapists, you will now see the reason why we said weight reduction, doing exercise alone may not help much. We have to add weight reduction with what do you call it? With calorie, can we say restriction, and weight management. We have to what do you call it? Imbibe these two: weight management through nutrition, what do you call it? Adjustment in the nutrition or calorie intake. We together with exercise, because that is what is going to really help. Okay. Therefore, we are now going into weight reduction. Therefore, the way we used to do it, weight reduction by the way of introduction, we have to reintroduce our parameters that we are going to use. 1 liter of oxygen is equal to 5 kilocalories. Therefore, anybody that utilizes 1 liter of oxygen is equal to 5 kilocalories. That is the reason why in the calculation of kilocalories, you now see 1.5 in the formula. That 5 means 1 liter of oxygen. When you burn 1 liter of oxygen, you are going to expend 5 kilocalories. And then remember, we said 1 kg is equal to 2.2 pounds. Therefore, if you have 10 pounds, you divide by 2.2, you are going to get the value in kg. And then we said 1 pound. This is very important in this calculation. 1 pound of fat. 1 pound of fat. The weight of what do you call it? 1 pound of fat is equal to 3,500 kilocalories. But remember, 1 kg of fat is equal to 2.2. 1 kg of fat is equal to 2.2 pounds. 1 kg meaning that is greater than pound. Therefore, 1 kg is equal to 2.2 times 3,500, which is equal to 7,700 kilocalories. Therefore, if our calculation is in kg, we use 1 kg. For you to lose 1 kg of weight, you have to burn 7,007 kilocalories. For you to lose 1 pound of weight, you have to lose 3,500 kilocalories. This is what we are saying. Please, for you to lose 1 pound of fat, you have to exercise to the extent that you lose 3,500 kilocalories before you lose 1 pound of fat. For you to lose 1 kg of fat, to reduce from your weight of, let's say, 75 kg to become 74 kg, to lose 1 kg of fat, you have to do exercise that will be equal to amount to 7,700 kilocalories. If you're able to do that, shikenan. Another important calculation that we need is kilocalorie per minute. Because if we don't know kilocalorie per minute, how do we calculate if one is to exercise for 30 minutes? Therefore, when we calculate kilocalorie per minute, when we now multiply by 30, we now see the extent of how many calories is he calculating? How many fat are we going to burn? Then remember again, we have VO2 times metabolic equivalent. VO2 is equal to metabolic equivalent times what? 3.5. These calculations are very important. 1 liter of oxygen is equal to 5 kilocalories. 1 kg of fat is equal to 2.2 pounds. 1 pound of fat is equal to 3,500 kilocalories. 1 kg of what do you call it, of fat will give you 7,700 kilocalories, and kilocalorie per minute is equal to VO2 times body weight divided by 200. Now, the next thing is what we call target weight loss. You as your therapist, patient comes to you and you want to reduce 10 pounds of weight in him, or 5 kg. how long are you going to exercise it? What is the time? How are you going to plan it? That is the target weight loss. So let's see if we can do justice to this side also. They said if a 62 kg female run on a treadmill and expend 2.7 meters, meaning that she runs on a treadmill and she burn 12.7 meters, she needs to lose 10 pounds. That is 4.55 kg of fat. This woman said when she come to you, she told you that she want to lose, please, Katemekeni, Oga, please help me. I want to lose 10 pounds. Please, if you divide 10 by 2.2, you are going to get 4.55 kg. Therefore, she come and tell you, if it's an American, she tell you, I want to lose 10 pounds of fat. Then if it is a Nigeria, she told you, I want to lose 4.5 kg. Can you help me prescribe exercise that will help me lose 4.5 kg? He said, yes, I can put you on treadmill. But for how long? She is 62, what do you call it? 62 kg. You put her to run on treadmill and she expend, by your calculation, she expend 12.7 meters. For how long are you going to, what do you call it? For how long are you going to treat her to get this particular fat to be burnt? Therefore, the first question is, how many 30 minutes workout will she have to complete at this workout to accomplish weight reduction of 4.55 kg? B, for how many weeks? If you are treating her 30 minutes, 4 times weekly, for how many weeks is she going to spend doing this exercise? Remember, if you are treating her 30 minutes every day, 4 times weekly, how long is she going to spend coming to your gym as a physiotherapist to lose 4.55 kg of fat? That is what the calculation is telling us. Then we have 2 methods of getting this answer. We can calculate using 1 kg of fat equal to 7,700, or 1 pound of fat is equal to 3,500. We can use this to get what we want. But all our ultimate aim is to make sure that we calculate the total number of weeks this woman is going to spend so that she can burn 4.55 kg of fat, or 10 pounds of fat. Okay, solution A. Solution number 1, we want to know. Then now the first item is weight to lose. The amount of weight we want her to lose. Is it in kg or in pound? The first solution number 1 is we want to use kg. Therefore, we want her to lose 4.55 kg of fat. But remember, 1 kg of fat is 7,700 kilocalories. Therefore, 4.55 kg will now be equal to 4.55 kg times 7,700, meaning that we want her to do exercise that would help her lose 35,500. Yes, that is 35,055. We want her to lose 35,055 kilocalories based on 4.55 kg, and each kg is 7,700. When you multiply by 7,700 times the number of fat we want to burn, 4.55 kg, will give you 35,055 kilocalories to lose. Then how do we now get the number of weeks that she's going to burn? Then we have to know. The only way to know this is we have to calculate the kilocalories she is going to spend per week. Then when we divide this number by the kilocalories she's going to spend by weeks, we are now going to get the number of weeks. Now, the issue is, remember, in the question, she is expending 12.7, what do you call it, METs. Remember, in the question, she is expending 12.7 METs. And we want to calculate, we want to know her kilocalories. The only way to get kilocalories is to get VO2. We cannot calculate calorie with MET direct. We only calculate calorie with VO2. Therefore, we want to convert the MET to VO2. Therefore, when we say MET times 3.5 is going to give us VO2. Therefore, the MET is 12.7 times 3.5 is going to give us 44.5 mil per kilogram per minute. That is the VO2. Then we now want to calculate the kilocalorie per minute. In every minute, how many kilocalories is she expending? Therefore, we say VO2 times body weight divided by 200. She is expending 13.8 kilocalories every minute. Then in 30 minutes, because she is coming to expend 30 minutes per session 4 times weekly in your place. Therefore, for each 30 minutes, how many kilocalories? Therefore, in kilocalorie per minute is 13.8. Multiply by 30 will give you 414 kilocalories. Meaning that every 30 minutes, every session she is spending 414 kilocalories. But remember, the total number of kilocalories we have to burn in order to get, we have to burn 4.55 kg is 35,500. Then, but remember, in every 30 minutes, she's spending 414. When we divide 35,500 by 414, we are going to get the total number of sessions she is going to spend of 30 minutes. That is what we have here. Total number of sessions should equal to calorie to lose. We said calorie to lose, which is equal to the total calorie you want to burn, which is 35,500, divided by calorie per session for 30 minutes, which is going to, then they tell us that we are going to spend 84.6 sessions, meaning that she's going to come to me 84 times. Then how do I now make this 84 times per week? Remember, she is coming 4 times weekly. Therefore, since this one is just per session, then we now said, okay, if that is the case, this is weekly, then we now divide it by the total number of weeks, by the total number of sessions per week. We divide by what? 4. She is coming 4 times weekly. When we said for 84 divided by 4, meaning that she's going to come for 21 weeks, meaning that she's going to be coming to the therapy for 5 months to lose 5 kg.
Just to lose 5 kg.
Just to burn 5 kg. In essence, what we are really saying is that, remember what we did here is we said she's going to spend only 30 minutes. Remember what we used to say, for you to burn fat, they said the recommendation, the exercise should be at least 1 hour. If it were like 1 hour every day, meaning that she may need only 2.5 months. Is that also? The total number of the session, if you cut the session low, 30 minutes, everything is done in 30 minutes, you are going to spend. But if you cut the session like 1 hour every day, then definitely when you calculate, you are going to get like 10 weeks, 2.5 months. It's okay. Therefore, when you cut the sessions small, then you are going to spend more time. Okay, now, this is solution number 2. Are we going to get the same thing? Now, we are now not using kg of fat. We are using kilocalories. We are using 1 pound of fat. Remember, she said she wants to lose 10 pounds, and 10 pounds is 4.55 kilocalorie. There are kg. We are now not using kg. We want to use pounds. 4.5 pounds, 10 pounds. Therefore, each 1 pound of fat is 3,500 kilocalories. 10 pounds is 3,500 times 10, which is going to give you 35,000 kilocalories. Now, we are left with, how do we now calculate how to get 35,000 kilocalories to burn? Remember, we said VO2 times base times 3.5 is going to give us VO2. We have already calculated how we determine how to get VO2. Kilocalorie per minute we have already calculated. We have our VO2 that we calculated 44.45 times the weight divided by 200 is 38 kilocalories. Kilocalorie per 30 minutes. Since we got it per minute is 13.8, per 30 minutes is 30 times this, which is going to give us 414. Total number of sessions we want to get is, we have to know the what do you call it? Remember, we have calculated the total number of kilocalories to burn 10 fat at 10 pounds of fat, which is 35,000. We said 35,000 divided by 414 is going to give us 84.5. Then meaning that you are going to get 84.5 sessions of 30 minutes to burn 10 pounds of what do you call it, fat. Then since each 30 minutes we are doing the exercise for 4 times weekly, then we divide 84.5 divided by 4. Then we are now going to get 21 weeks. This one is calculated. Then classwork. I'm going to leave this one for you for the next time. Okay, a 25-year-old woman who weighs 130 pounds. Remember, 130 pounds is around 130 pounds is 130 divided by 2.2. What you get is the weight you get in kg. A 25-year-old woman weighed 130 pounds has a net relative VO2 of what? 20.5 5 mil per kilogram per minute. They have already calculated it that is 20.5 mil per kilogram per minute. They said if she runs for 40 minutes, 4 days per week, if she runs for 40 minutes, 4 days per week, how many kilocalories will she burn? That is the first one. 40 minutes, 4 days per week, how many kilocalories will she burn? Then the second one, they said, at this rate, how many weeks will it take her to burn 10 pounds through this exercise? Let's see what will happen. Let me give you some few minutes.
What's so funny?
Okay, so she burns when you convert that weight to pounds, that's from pounds to kilogram, that's 59.1 kilogram. Multiplied by the VO2 that we have, that's 20.5 divided by 200. So per minute, she burns 6.05. Now that's 6.05 times 40 minutes is equal to 242. And then 4 days a week, that's 968 for the A question.
Okay, I'm with you. What are you saying, please?
I said our weight in pounds converted to kilogram is 59.1 kilogram. So multiplied by the VO2, which is 20.5 divided by 200 is 6.05 kilocalories per minute. So that times 40 minutes is equal to 242. So 4 times a week is 968 approximately.
968 approximately. You got it, ba?
Yes.
Yes. Therefore, who got it the way she got it?
I got
Please, who?
969.24.
Yes. Therefore, whatever you got 968, 969, but at least I know it's because of rounding up of this one, but approximately it's around that figure. But
Yes, sir.
therefore, if we're able to get that one, then we now said at this rate, if she continues doing this at this rate, this is per week, 40 minutes, 4 days per week. They said, if this woman continue this exercise, how long will it take her to burn 10 fat through this exercise? Now calculate. Remember, 10 pounds is going to give you, each 1 pound is going to give you 3,500 kilocalorie. Is that not so? Then 3,500 kilocalorie times 10 will give you 35,000 kilocalories. Then the rest, you know what to do. Let me leave you. I can target whenever it's very useful. Idan zan baka shi white man baya zuwa yi mix da in kama mutum awa daya ita ka bashi awa daya da su sati 10 kai shi ko 15 ka bashi minti 20 ya dade na zuwa da zuwa. Okay. Idan ka raba in ka saka 35,000 35,133 divided by wannan abin da ke kai divided by 696.2 696.2
36 weeks.
Yeah, so we got it. 36.1 weeks.
That's 6.1 weeks.
Yes.
Because this kilocalorie is per week. Therefore, okay, now tell others how you get 36.1 weeks so that they understand how you did.
So multiply 10 pounds that she wants to lose and convert it to 35,035 and then now divide
multiply it by, since we said 1 pound is 10 15 3,500 kilocalories, then if we want to lose 10 pounds we have to lose what 10 times 3,500, that is 35,000 kilocalories.
Yes.
Okay,
yes.
After that one
it now divided it by the answer that we got earlier. So
okay.
Divided that by 969 gave 36.1.
Divided by, then meaning that this individual is going to spend 36.1 weeks with us.
Yes.
36.1 weeks. If we now say how many months, you know? You divide by, if you divide by 4, you are going to get it. Because every month is 4
9
weeks.
months.
She's going to spend what? 9 months with us. Meaning that the issue is the amount of energy she is expending probably is low. Therefore, she's like going to spend 13 weeks, but okay, yes. You know, for pregnant women, it's around 38 weeks. Is that also? Almost 7 months or so.
Yes.
Therefore, in a way, we have found a way of calculating, targeting, what you call it, weight reduction in our clinics. Cool?
Yes.
Okay, now let's move. Please, I don't know how many were able to get this one correctly, the way she did. Okay, we are gradually.
I got it.
Okay, so then we are gradually coming to an end. Target weight loss. Let me give you this one. Although this one I have already provided the solution, but let's go through it. A 70 kg man uses 2 liters of oxygen in 1 minute. 70 kg uses what? 2 liters of oxygen in 1 minute. Remember, every liter is 5 kilocalories. Then they said, how many kilocalories did he burn? I put it in bracket, 10 kilocalories, because he's using 2 liters. But what is exercise what was his exercise capacity in METs? What was his exercise capacity in METs? Capacity in METs is around 8.16 METs. Then what is the total amount of weight to lose if he exercised 30 minutes per session 3 times weekly for 12 weeks? If this guy is just taking 2 liters of oxygen in every 1 minute, when you calculate that he's taking 2 liters of oxygen every 1 minute, then what will happen if he exercises for 30 minutes 3 times weekly for 12 weeks? How many amount of weight is going to lose? Okay, let's go through the calculation. We said 1 liter of oxygen is 5 kilocalories. 2 liters will be 10 kilocalories. I think we are okay, go. Then we now say kilocalorie per minute. Remember we said VO2 times body weight divided by 100 is our kilocalorie per minute. Remember this guy is expending 10 kilocalories because he is expending 2 liters per minute. Therefore, is 10. Therefore, his kilocalorie per minute is 10. I think we are not confusing. They said this guy is expending he's using 2 liters of what? Oxygen per minute. Then when we calculate the equivalent of 2 liters per minute is 10 kilocalories, meaning that the amount of calories expending per minute is 10 kilocalories. Then remember his weight is 70 kg. We know 200. The only thing we don't know is his VO2. Is that not so? Therefore, we now say VO2 is equal to 10 kilocalories times 200 divided by 70, which is equal to, what do you call it? 200 divided by 7, which is equal to 28.75 mil per kilogram per minute. And the MET is expending MET is equal to VO2 divided by 3.5, which is equal to 28.57 divided by 3.5, which is equal to what? 618 MET, meaning that we have calculated the answers we give in the bracket. Huh? Then the next, the C part is where we are going to stop today. The C part, what is the total amount of weight if this guy is using 2 liters of oxygen per minute? What is the amount of weight is going to lose when he exercises for 30 minutes per session 3 times weekly for 12 weeks? Even when we are doing master's program, usually nobody from us are saying your patients are coming for 30 minutes 3 times weekly for 12 weeks. We said you are going to find something reasonable. Let's see which reasonable is this guy going to get in the fat. Okay. Okay, this is the solution. 30 minutes per session, 3 times weekly for 12 weeks. Total number of kilocalorie per session is 10 times 30. Remember, if he is spending 30 minutes, and then remember, kilocalorie per minute is 10. Therefore, 10 times 30 is 300 kilocalorie. Then the total number of calories per week. Remember, this guy is doing is 3 times weekly. We now say 300 kilocalories times 3 will give us 900 kilocalories. Then total number of kilocalories is going to expend per 12 weeks, meaning that per week times 12, which is going to give us 10,800 kilocalories. Then what is 8,000 kilocalories when it comes to conversion to what? To kilogram of fat. Remember, 1 kg of fat is equal to 7,700. Remember, we said 1 pound of fat is 3,500. But 1 kg of fat is 3,500 times 2.2. That is what is going to give you what? 7,700. Then total weight to lose. We are expecting that this guy is going to lose 10,800 kilocalories. Therefore, 10,800 kilocalories divided by 1 kilocalorie for 1 kg of fat. Remember, 1 kg of fat is 7,700. And this guy, in the last 12 months, in the last how many weeks? 12 weeks, we are expecting that he's going to lose 10,700. Therefore, when you divide it, this guy is only going to lose 1.4 kg of fat. Look at it. This guy is running every day for 12 weeks, 3 times, but at the tail end, what amount of fat did he lose? Only 1,000, what do you call it? 1.4 kg of fat. This is to tell you that no matter what we do as physiotherapists, we have to, what do you call it, imbibe these two: nutritional adjustments and exercise for us to achieve what we want to achieve in weight loss. For exercise to be effective, for exercise to reduce weight in individual, he has to keep coming to physiotherapy department or going to gym for some time That is why they talk about adherence to exercise. It's the most important thing. Keep doing exercise. One should spend some time going for exercise, not just 10 weeks, 12 weeks, before he is going to see one significant change. And another factor is when one comes to do exercise, let him spend at least 1 hour doing exercise. If not, he's not likely going to get meaningful weight reduction. Okay, they say we should calculate using weight of 1 pound of fat if you can get it. Now, departing the classwork, they said an 8 kg, 80, I'm not going to ask anybody to give me answer. Go home and do it yourself. An 80 kg man has a net VO2 of, 35.7 mil per kilogram per minute. If he exercises at this intensity 5 times a week for 30 minutes per session for 20 weeks, how many pounds of fat is he going to lose? Don't tell me the answer. Keep it to yourself. I wish you all the best. Thank you very much. We are closing for today.
Hello, sir. Excuse me, sir. I have a question, sir.
Okay, I'll ask, please.
The just concluded calculation, sir.
Yes.
If you just go back a little bit, sir.
Yes, I have gone back.
Yes, sir. Sir, do you mean this 1.4 kg? Is this man going to lose only 1.4 kg in 12 weeks or weekly?
Yes.
Is he going to lose 1.4 weekly?
No, see, one
Yes, sir.
thing is, 1 kg of fat.
Yeah.
Altogether, 1
Yes, sir.
kg of fat. This is 1 kg of fat that will give us 7,700 kilocalories. Is that not so?
Yes, sir.
Hello. Do you
Yes,
know
sir.
where
Yes,
you
sir.
get the problem? Do you know where you
No,
get the
sir.
problem?
Yes, sir. I'm with you, sir.
Yes. Is the total number of calories this guy is going to expend is too small,
Okay.
for the 12 weeks.
Okay. Well.
That is what causes the little something. He's only going to expend 10,800.
Okay.
Remember, kilocalorie per session is just, 10 kilocalories. No, per minute. Then for 30 minutes, it's only going to be 300 kilocalories. How many 300 kilocalories do you think are there in 7,700?
Yes, sir.
Therefore, the bottom line is kilocalorie per minute should be high for you to be able to burn a lot of fat.
So, sir, are we increasing the intensity or the duration of the exercise or the session?
Usually the duration of the exercise.
Okay.
If somebody is coming for weight reduction,
yes, sir.
You can put a moderate intensity and longer duration. Then it's better for him to be spending, like, let's say 300 kilocalorie per session. If he's spending 300 kilocalorie per session, yana bai zai losing fat da yawa.
Again, sir.
Ka san idan ka ce 300 kilocalorie times 30 is like going to be 9,000 kilocalories in 30 minutes.
Okay.
So amma in 12 weeks, he end up spending only 10,800. Shi yasa ka gaya maka kaɗan.
Exactly. Yes, sir.
So I wish you all the best.
Thank you so much, sir. We're grateful, sir.
Okay, thank you.
Thank you, sir.
Okay, thank you. I really want to apologize. I did
Thank
come
you,
to start
sir.
something on time. I have
Thanks,
to go to the
sir.
hospital and donate blood. But we thank God at least we are able to finish.
Thanks, sir.
Hello.
Thank you,
One
sir.
more question.
Thank you, sir. Thank you all. I
Thank
really
you, sir.
appreciate it.
Thank you,
Thank
sir.
you.
We are very
Thank you, sir.
grateful.
Please go and practice and practice. If not, you are going to forget.
All right.
Okay.
Yes. I
Thank
wish you
you,
all the best.
sir.
Sir.
Thank you.
Yes.
Now,
Okay,
Bye.
sir.
okay,
Please, will
bye.
we be able to get the material?
Yes, I'm going to prepare the materials. I'm going to send latest tomorrow. I'm going to send it today. Then they are going to share the materials to you, including the video.
Okay. Okay, sir. Thank you, sir.
Okay, thank you. I really appreciate you. Okay.